of the Commission, staff of the Secretariat, and our interpreters. A very warm welcome to our distinguished state delegates, NHRIs, and civil society organizations for this fourth day of the 68th Ordinary Session of the African Commission on Human and People's Rights. I am mindful that this is Saturday, and would like to thank and express the appreciation of the Commission for all the delegates who are joining us on this Saturday as well, as part of this 68th Ordinary Session of the Commission. Just by way of a quick recap from the third day of the 68th Ordinary Session. Yesterday we had one of the most important activities of the Commission, which relates to the review of state reports. And we had the privilege of receiving and engaging in an interactive exchange with Malawi. The delegation of Malawi presented the periodic report of Malawi covering the period 2015 to March 2019. And on the basis of that, colleagues, members of the Commission raised a wide range of issues and questions in order to have a better understanding of the state of human rights in Malawi and issues that require attention and further feedback from Malawi. And we, of course, welcome the submission of the report, both on the African Charter and on the Maputo Protocol on the rights of women. And we wish to reiterate our call from yesterday, including from the update, the status update on the submission of reports that Commissioner Hatton presented, on all states to continue to submit their reports and meet their obligations of reporting under Article 62 of the African Charter, Article 26 of the Maputo Protocol, and Article 14 of the Kampala Convention. And wish to reiterate Commissioner Maya's point yesterday about the importance of the Kampala Convention, particularly in a context where there are climate-related displacements affecting countries like Malawi. The cyclone the year before have affected a number of people in Malawi and other parts of Southern Africa. So the importance of the Kampala Convention can't be emphasized. And we wish, of course, also to note that the attention that has been given to various areas of human rights and the challenges that have been identified, including as it relates to the implementation of socioeconomic rights, as well as those affecting particular category of people, including persons with disabilities, particularly persons with albinism. I wish to also note that yesterday we received a statement from states parties to the African Charter, particularly from Tanzania. We also received a statement from national human rights institutions, particularly the National Human Rights Commission of Ethiopia, and one NGO. And some of these highlighted some human rights issues, apart from providing us with update on the human rights situation of specific countries such as Tanzania and Ethiopia, specific areas of concern, such as those relating to Ethiopia and those relating to the safety of journalists and the protection of the media in Southern Africa from the statement of the NGO. Today, we will focus exclusively on agenda item 3, which relates to the situation of human rights. And within that framework, I will be happy now to give the floor to the list of national human rights institutions and civil society organizations. As I do this, since we had difficulty connecting with Ambassador Makaya, the permanent representative of South Africa to the AU, if Ambassador Makaya is connected now or is connected in the course of this session, kindly let us know. Now, in terms of the list of speakers, I have with me. I wonder if we have the National Human Rights Council of Algeria. Do we have the National Human Rights Council of Algeria? Okay. We had difficulty having connection with them yesterday as well. We will give them the opportunity to deliver their statement when they are connected. Okay, let me check. How about Human Rights Commission of Zambia? Do we have the representative of the Human Rights Commission of Zambia? Excellent. I think we have the representative of the Human Rights Commission of Zambia. This is the National Human Rights Commission with observer status number 14.
Chair, I can proceed?
You are very welcome. If you kindly put on the video as well. Excellent. Very warm welcome. Please proceed. Thank you for coming.
Chair. Thank you, Chair. The Honorable Chairperson of the African Commission on Human and People's Rights, the Honorable Commissioners of the African Commission on Human and People's Rights, representatives of state parties, national human rights institutions, and civil society organizations, sister human rights bodies of the African Union, distinguished ladies and gentlemen. We're privileged as a Human Rights Commission of Zambia to be part of the 68th ordinary session and make a statement as a national human rights institution. Indeed, 2021 is a momentous year for Zambia as we prepare to go to the polls. On the 12th of August, 2021, Zambia will hold its presidential and general elections. There is a heightened anticipation of a competitive environment. The application of the Public Order Act will be an important aspect of the 2021 elections. Over the years, the Commission has observed that the bias application of the Public Order Act by law enforcement officers is one issue that needs to be looked at as we move to the August 21 by-election, presidential and general election. If this is not resolved, it will potentially be a trigger for political violence. Sorry, Chair. Sorry for that, Chair. If this is not resolved, it will potentially be a trigger for political violence and consequently impact the right to associate, information, and exercise of the right to vote. Therefore, the Commission on its part continues with its strategy of engaging the different political parties, including civil society, to diffuse potential political conflict in Zambia. In addition, in 2021, it will host an early warning system for prevention and management of conflict. The COVID-19 pandemic has exacerbated challenges that vulnerable groups such as women, children, persons with disabilities have continued to face. The Commission, under its mandate, monitored and has continued to monitor the impact of COVID-19 in places of detention, places of work, health, the electoral process, and the informal sector. Generally speaking, in the immediate, the negative impact of COVID-19 in places of detention is that there has been a heightened risk of contracting the disease, as most of these detention facilities are congested way past their capacity hold. In terms of the electoral process and voters' right to register, we found that the need for the Electoral Commission of Zambia to observe the public health regulations led to delays and inadequate time given to citizens to register as voters. And a good number of employers sent workers on forced leave, and sometimes without the employees receiving their outstanding dues, and obviously consequently increasing household vulnerability. The state's responsibility to protect, respect, and fulfill human rights in these times is paramount. Like most countries across the globe, Zambia's current economic downturn has exposed limited coping capacities amongst the most vulnerable, including women, children, and persons with disabilities. The state must ensure that it responds to this status quo by adapting the current interventions to reduce the high poverty levels being witnessed and ensure incorporation of effective strategies and interventions in the 8th National Development Plan that commences in 2022. Finally, Chair, 2021 witnessed the enactment of cyber and data protection laws in Zambia. Without a doubt, the need for such laws are important in national security and protecting individuals. However, the potential abuse of such laws in shrinking the democratic space and curtailing freedom of expression is a living threat. There is a high responsibility expected on the part of the state to balance the two in a democratic society such as Zambia. The Commission will proactively monitor potential violations of human rights in this regard. Chairperson, I thank you.
Thank you very much to the National Commission of Human Rights of Zambia for providing us that important update on the situation of human rights in Zambia, particularly drawing the attention of this commission through our country rapporteur for Zambia to some of the issues that we have to be mindful of in 2021, including the upcoming 12 August 2021 national elections and issues associated with those elections, including, for example, the delay and the inadequate time that has been given for voter registration and the impact that this would have in disenfranchising members of the electorate. Issues relating to the implementation of the Public Order Act, and if experience anything to go by, as the National Human Rights Institution of Zambia put it, we have to be concerned about the biased application of this Public Order Act and need to join the National Human Rights Commission of Zambia in urging the government of Zambia to heed the lessons of the past and ensure that the biased application of the Public Order Act is not repeated. And indeed, if it's going to be repeated, we have been warned. I think we have listened. We have been warned that it could trigger political violence with severe consequences to the right to associate, information, and voting. And we also take note of the issues that have been raised as far as COVID-19 and its impact is concerned, including issues relating to the danger of spread of COVID-19, particularly in places of detention due to congestion. And perhaps one of the things that we wish to ask the National Commission of Human Rights of Zambia is if they could provide statistics about the percentage of spread of the virus in places of detention. I think getting a disaggregated data on the spread of the virus in place of detention would help in terms of really demanding that actions are taken to protect people in places of detention as well. And of course, I think issues relating to people being forced to be on leave without pay, the economic downturn and its consequences, particularly on the most vulnerable, and the application of the Cyber and Data Protection Act and its chilling impact on the democratic space, as well as on freedom of speech. These are issues that I think we need to follow closely and work with the government of Zambia to ensure that these various issues do not trample on the rights and freedoms guaranteed in the African Charter, the Maputo Protocol, and other relevant instruments. Thank you very much for the National Commission of Human Rights of Zambia. Do we have the representative of the National Human Rights Commission of Mali with us? Okay, we don't. So we will give the floor to both the National Council of Human Rights of Algeria and that of Mali whenever they join us. I would now proceed to invite distinguished delegates of non-governmental organizations. Yesterday, I asked if we have the representative of Legal and Human Rights Center. Legal and Human Rights Center. Okay, we have, I think, the representative of Legal and Human Rights Center. This is the NGO with observer status 244.
Okay. Hello.
Can you? Excellent. Most welcome to this session of the Commission. You have 5 minutes, please.
Okay, thank you, Honorable Chairpersons and of the Commissions, distinguished commissioners and delegates of the African Union, state delegates, members of non-governmental organizations, and all protocols observed. Our statement for the 68 ordinary sessions of the African Commissions, we wish to stress on a number of issues, among them at least 5, that includes the situation of the civil and political rights in Tanzania, social and cultural rights, protection of women and children, and protections of human rights in the business sector. To start it, on civil and political rights, remember that in the last year, Tanzania held its 6th general elections in October 2020, and the election was conducted in a circumstance with deepening existing political situations, and those situations has remained unaddressed at least until now. That will request the commissions for intervention to ensure that the political processes are guaranteed to all stakeholders. On economic and social and cultural rights, we acknowledge that there has been some positive measures that has been undertaken by the government to address that, but there has been inadequate or delayed or partial undertaken by the government to ensure that, for example, disbursement of funds to the students in higher learning institutions. Tanzania has also not annulled its stance regarding the expulsions of girls who got pregnant in schools. Also, we all know that the world has been hit by the novel coronavirus from the last year, and this is a really threatening social issue. But Tanzania has continued either neglecting or denying the existence of the coronavirus, leading that the government has centralized the process. There is no any measures taken to address the spread of the coronavirus. Also, there is another issue regarding the situations of the indigenous groups in Tanzania who are living mostly in Tanzania protected areas. The law has been categorizing those citizens are like a second-class citizens, but on 6 this month or April 2020, the President Samia Suluhu Hassan issued a statement signaling that they want to displace the community from the ancestral territories, and at least as of yesterday, they have started some undertakings to ensure that the president's statement is executed. Regarding the protections of women and children, we acknowledge that there has been some measures taken all over the country to address the situation of women's rights and children. However, there are concerns of violence of women and children, mainly the sexual domestics by the intimate partners, sextortion, online harassment, and this has been largely witnessed in the last general election, where women candidate has been harassed during the political campaign. Protection in the human rights sector, the situations of rights and business faces challenges with lack of the national human right and business loopholes in the laws and the practices. The tax collections generally has been used by the government to coerce individual who seems to be having different opinion with the government. So the national laws on taxations has been misread by the government. We observed poor participations of the community members to proceed.
Okay, unfortunately, we have lost connection with the delegate representing Legal and Human Rights Center. But if the list that was presented is anything to go by, I think he was presenting the last item relating to human rights in the business sector. So with that, I wish to thank Legal and Human Rights Center for providing us that update on the human rights situation in Tanzania, focusing on civil and political rights, particularly drawing the attention of the Commission on issues relating to civil and political rights arising from the election that took place in Tanzania, and the measures that need to be taken in that respect. In terms of economic, social, and cultural rights, Legal and Human Rights Center acknowledged the progress that have been made in Tanzania in that respect, but noted certain areas of concern, such as disbursement of funds to higher learning institutions, and also the exclusion from education of certain category of people, particularly pregnant girls and teen mothers. I think this has been a recurrent issue in our session for the last several sessions, and we join and reiterate our earlier call that excluding girls and teen mothers on account of their status as pregnant or as mothers is a direct violation of Article 2 of the African Charter. It is discrimination on the basis of sex. Those who cause the pregnancy, the male, they continue to enjoy their right to education, but the girls and the teen mothers are being excluded. And this is not acceptable. And we wish to reiterate our call and appeal to the government of Tanzania to review this policy relating to pregnant girls and teen mothers. The impact of COVID-19 have been noted. It has been an issue that the Commission has already communicated on with the government of Tanzania, and we look forward to measures being taken as announced by the President of Tanzania since assuming power. We take note with concern issues relating to the indigenous peoples in Tanzania, including the threat of their displacement from their ancestral land. I hope myself as the country rapporteur and my colleague, the chairperson of the working group on indigenous peoples and minorities, would follow up on this one. Online harassment of women and other forms of harassment that women are subjected to during elections is something that needs to be followed up so that this doesn't happen again. Thank you very much once again to Legal and Human Rights Center. May I now call on the Southern Africa Litigation Center? Southern Africa Litigation Center. No? Okay. Let's try IPAS Africa Alliance. IPAS Africa Alliance. Okay. Okay, you are most welcome to this session of the Commission. You have 5 minutes, please. Kindly proceed.
Thank you, Honorable Chairperson. Honorable Chairperson, Vice Chairperson, Honorable Commissioners, distinguished state representatives, ladies and gentlemen, all protocols duly and respectfully observed. I'll be making the presentation of the statement on behalf of IPAS Africa Alliance, which is an NGO with observer status number 421 that focuses on reproductive health rights. We would like to thank the African Commission on Human and People's Rights for its continued push to advancing human rights in Africa, especially on sexual reproductive health rights. The theme for the Africa Union for the year is Arts, Culture and Heritage, Levers for Building the Africa We Want. In the context of the EU theme for the year, IPAS will highlight the plight of women and girls accessing sexual reproductive health services, including safe and legal abortion. Whilst we celebrate the richness of African art and culture, including the important role that art and culture play in mobilizing and unifying people around common ideals and promoting African culture, we are also cognizant of the role culture and heritage plays in the health-seeking behaviors of women and girls in Africa, particularly for maternal and reproductive health issues, such as diagnosis of treatment of STIs, teen pregnancies, and unsafe abortions, which are highly stigmatized and shrouded under heritage and cultural practices. We note with concern that our culture and arts is used to perpetuate value-based systems that discriminate against women and girls, to rationalize and justify the limitation of the autonomy of women and girls from seeking reproductive health services from healthcare facilities. Retrogressive cultural attitudes, norms, and behavior also continue to perpetuate violations of human rights against girls and women through such harmful practices like the various taboos or practices which prevent women from controlling their own fertility, such as beating, pressing, or massaging the abdomen to expel a pregnancy, or the use of herbal mixtures, or even magic. Honorable Chairperson, we recognize that state parties have put in place commendable efforts to ensure protection of human rights in line with the Africa Charter on Human and People's Rights and the Protocol to the Charter on Women's Rights, popularly known as the Maputo Protocol. However, much more needs to be done by state parties towards ensuring that there are proper sexual and reproductive health policies and legislation that provide for safe abortion to women and girls. The Republic of Malawi is coming up for review and actually began their review process yesterday during this ordinary session. Maternal mortality rate of Malawi remains one of the highest on the continent, at the rate of 439 women dying amongst 100,000. And the Commission needs to remind the Malawi government to do its duty of bringing this ratio further down in protection of the right to life of women and girls in Malawi. It's estimated that of this number of 439 per 100,000, 18% of the maternal deaths in Malawi are due to unsafe abortions. One of the reasons for this situation is the current restrictive abortion law in the country. In this regard, the Termination of Pregnancy Bill has been developed that has in place provision of access to safe abortion in line with Article 14 of the Maputo Protocol. In the concluding observations of the previous report, the Commission recommended Malawi to enact the GOP bill. Early in 2021, A private member attempted to move the TOP bill, but this was blocked before being tabled in Parliament. Teenage pregnancies remain high, and the COVID pandemic has worsened the situation, with over 40,000 young girls failing to go back to school as a result of teen pregnancies. We call upon the Commission to put the country to task on the passing and implementation of the TOP bill, as well as enacting age-appropriate comprehensive sexuality education for in-school and out-of-school adolescents to curb the high numbers of unintended teen pregnancies and maternal mortalities, which have even further been exacerbated by the COVID-19 pandemic. Let's continue to encourage more African states to review restrictive and penal laws on abortion as part of implementing the ACHPR campaign for the decriminalization of abortion in Africa, which was launched in 2016 through the Office of the Special Rapporteur on the Rights of Women in Africa. This campaign reaffirms the WHO reports that making abortion illegal does not reduce abortion rates nor deter women from getting abortions. There is, however, a direct correlation between restrictive laws and a woman's access to safe abortion services. Several countries across the continent are working towards decriminalizing abortion in their context. The past years, the Democratic Republic of Congo has diligently worked on promoting women and girls' sexual and reproductive health rights. In 2018, the Maputo Protocol was ratified by the Congolese government. This was followed by an even more progressive move through the validation of the standards and guidelines for provision of abortion services by the Ministry of Health in December 2020. These remarkable achievements show not only the government's commitment to bringing change in an extremely patriarchal society, but also that of the civil society in the country. The Republic of Mozambique has also made great strides in the provision of sexual and reproductive rights.
Your time is up. Your time is up. Can you conclude?
All right, Chair. I'll move to our recommendations, as our statement was already shared with the Secretariat for the Chairperson and the Honorable Commissioners. So in conclusion, Honorable Chairperson, ladies and gentlemen, given the foregoing, we call upon the Commission to, 1, urge state parties to address existing cultural and sexual and heritage-related barriers that are impeding women and girls' access to reproductive health care. 2, with increasing crisis in Africa, encourage all countries to safeguard sexual reproductive health services. And lastly, continue to work with member states in partnership with civil society organizations to scale up the implementation of the ACHPR campaign for the decriminalization of abortion in Africa, and continue to urge state parties to submit state reports on the implementation of the Maputo Protocol. I thank you, Honorable Chairperson, and I hand over back to you.
Thank you very much. That was the statement from IPAS Africa, focusing primarily on reproductive health right of women and girls, which is under Article 14 of the Maputo Protocol. It's of note that the statement drew attention to the impact of negative cultural practices on the reproductive health of women, including in terms of restricting the autonomy of women as far as fertility is concerned, issues relating to maternal mortality rate, particularly in Malawi, giving us a rather serious figure: 439 women or girls lose their lives on account of maternal mortality. And this is a very serious figure. And a lot of families and communities lose women and girls in this process, a very serious deprivation of the right to life. So we indeed join in calling for actions being taken to address this scale of maternal mortality. And also the question about 50,000 girls, schoolgirls, not being able to go back to school due to issues of pregnancy that arose in the COVID-19, in the context of COVID-19 pandemic, and the issue of decriminalization of abortion, which is adopted by the Commission, and the need for continuing to do the campaign for decriminalization of abortion. And I also welcome the positive the recognition of the positive development in the Democratic Republic of the Congo, as far as addressing issues relating to reproductive health of women and girls is concerned, through the adoption of the Maputo Protocol, but also importantly, through measures taken by the Ministry of Health as far as the reproductive rights of women and girls is concerned. And we do hope that other states parties to the African Charter and the Maputo Protocol follow the example of the DRC in this respect. Let me now move to the next NGO. This is MAD for Peace, Development and Human Rights Association. If we have the representative of this NGO with observer status 5 to 8.
Yes, Honorable Chair.
Can you kindly put on, okay, the video, excellent, most welcome. You have 5 minutes, please.
Thank you so much. Honorable Chairperson, Honorable Commissioner, distinguished delegates and representatives of national human rights institutions and NGOs. As a part of expressing the civil society points of view about the human rights in Africa, it is our pleasure to share with you some concerns about the right to water challenges in Africa, specifically the current disagreements among Nile Basin countries. Principally among the 3 Nile core countries, Ethiopia, Egypt, and Sudan. Since 2011 until today, there has been no concrete agreements on legal and political concerns, filling and storage mechanisms, dam administration, use of water, development, and information sharing. The disagreement was also upon to agree to any binding agreement that take account of vulnerability and climate change. However, we see the Nile water as a source of cooperation rather than a source of conflict. We aim at preventing disagreements in the Nile Basin region and encouraging fair use of water benefits for the sake of comprehensive and sustainable development for all citizens. We appreciate that there is a significant importance of protecting and assisting all other African countries to resolve and avoid conflicts over the Nile water and related resources. Thus, we aim to prevent any water conflict in Africa in the future. Mr. Chairperson, we call on Egypt, Sudan, and Ethiopia to focus on common points rather than conflicting points in order to reach a middle ground, namely, fill the dam gradually based on the consensus of the 3 countries, which takes into account the climate change, floods, and droughts variability. We also assure that countries have total right to set up development projects for their people, but should put into consideration the impact this may have on other countries. The Ethiopian government may be advised to delay the second filling to avoid escalating the conflict. However, if Ethiopia suffers a loss due to this delay, the international community should come to its rescue. Egyptian and Sudanese government should facilitate such processes. And Egypt specifically may work towards supporting Ethiopia for its loss by supporting the implementation of development projects in Ethiopia and increasing trade cooperation. We would like to stress that all efforts have to be taken to build consensus before the second round of dam filling. Mr. Chairperson, as a result of the current situation, we would like to present the following recommendations. Number 1, there must be a water master plan for developing and utilizing effectively all water resources of the Nile Basin countries. Each country then should develop a plan individually and collectively based on an agreed master plan. Number 2, we call on ensuring coordination with transparency mechanisms. And finally, all steps must be taken to support regional cooperation and peaceful relations. The 3 countries should realize the importance of having a binding legal agreement that works on sharing the regional benefits of water resources in a fair and equitable manner. in a way that guarantees the right of mutual benefit of water resources.
Okay,
Honorable
thank you.
African Commission.
Thank you very much. Your time is up.
Thank you, Mr. Chairperson.
All right, thank you for that. I didn't want to cut you because what you have provided in your report, in your list, is to speak on the situation of human rights in South Sudan. What you did is something different, which is not immediately clear why you did that. All right. I just thought that, you know, other human rights body, we can't just, you know, shut people up in terms of freedom of expression. All right. Let me proceed to the next agenda item. International Commission of Jurists. Do we have the representative of International Commission of Jurists? No. Okay. Do we have Institute for Human Rights and Development in Africa? Okay, great. We have a problem. Okay. Can I ask if we have the Independent Medical Legal Unit?
Honorable Chair, this is the Institute for Human Rights and Development in Africa.
I'm not sure if your connection is good, but let's try. You have 5 minutes, please.
May I do my statement?
Please proceed. You have 5 minutes. I'll come to the National Human Rights Institutions of Algeria and Mali after that. You have 5 minutes, please.
Okay, thank you, Honorable Chair. Honorable Chairperson and Commissioners of the African Commission on Human and People's Rights, Honorable State Delegates, distinguished colleagues, ladies and gentlemen. The Institute for Human Rights and Development in Africa would like to congratulate the Commission for being able once again to organize its ordinary session virtually, despite the COVID-19 pandemic. We would like to bring to the attention of the Commission the plight of many children who are engaged in forced labor in the Republic of Ghana. Thousands of boys are forced to work on the Lake Volta as slaves to fishermen on the lake. Many of them are sold by their parents for as low as $250. The International Justice Mission puts the number of children working in the fishing industry in Ghana at 50,000, with most of these children working on the Lake Volta. The children perform tasks such as paddling canoes, removing net stock on tree branches in the lake, scooping water from leaking canoes, among others. This work puts a lot of the boys at risk of permanent injury and death. IHRDA has recently spoken to some of the boys who have been rescued, with some of them having been sold by their parents and starting to work in the fishing industry as young as 4 years old. These children work in the lake, not attend school, and they're made to work for as much as 12 hours every day. Many of the children told us about how they saw sorry, Honorable Chair, that's my network.
Please proceed.
Okay. Many of the children told us about how they saw other children die in the perilous conditions of the work. They told us about how children who die are simply buried at the bank of the lake, and other children bought to take up their place on the fishing canoes. Our investigations in Ghana also revealed that many of the perpetrators of this slavery are not prosecuted, and there is a lack of effective investigations to bring perpetrators to justice. In at least one case where the perpetrators were charged to court, the Office of the Attorney General of Ghana issued a nolle prosequi to terminate the prosecution of the accused persons, and the accused persons were left to roam free and be able to enslave more children. The government of the Republic of Ghana has simply not done enough to end this harmful practice. This phenomenon is in violation of Articles 5, 17, 18.3, 1 and 7 of the African Charter on Human and People's Rights, as well as several provisions of the African Charter on the Rights and Welfare of the Child. To this end, we urge the Commission to engage the government of the Republic of Ghana to end these harmful practices. We also invite the Commission to liaise with the African Committee of Experts on the Rights and Welfare of the Child, the committee, in its engagements with the government of Ghana on the issue, in accordance with the Commission's 2009 resolution on engaging with the committee to address issues affecting children. We also ask the government of Ghana to comply with its international human rights obligations and thus put an end to the practice of child labor, especially in the fishing and mining industries, effectively investigate all cases of child trafficking, exploitation, and labor, and bring all perpetrators to justice. Provide rehabilitation and access to education for all children who have been trafficked and subjected to child labor. Thank you for your attention.
Thank you very much for that statement of IHRA, focusing on the plight of children who are forced into child labor in the fishing industry in particular. Also, to the last part of the statement, reference was also made in the mining industry as well. And a staggering figure of about 50,000 children being used in the fishing industry with very serious consequences to the well-being of the children, their various rights, including the right to life, as children die in these conditions. Questions of accountability have also been raised, and we take note of the recommendations about engaging with the Committee of Experts on the Rights and Welfare of the Child for purpose of communicating these issues with the state party, Ghana. Thank you once again. Can I ask if we have now the representative of the National Human Rights Council of Algeria? Okay, great. I think we have the representative connected with us.
Bonjour, Monsieur le Président.
Most welcome to the 68th organization of the Commission. This is the NHRI with Observe Affiliate Status number 1. You are welcome.
Thank you, Mr. President. Monsieur le Président,
can you put on your video, please? Thank you.
Ok, merci, Monsieur le Président. Mesdames et Messieurs les honorables commissaires, délégués, distingués délégués, le Conseil national des droits de l'homme d'Algérie, qui a été institué par la Constitution et dont le mandat a été précisé par les dispositions de l'article 212 et notamment de la loi de sa loi numéro 16-13, a mené et mène, à l'instar des autres institutions nationales africaines des droits de l'homme, diverses activités d'information et de sensibilisation sur la pandémie de la COVID-19, ainsi qu'un suivi et une évaluation de l'impact de cette pandémie sur la jouissance des droits de l'homme et des libertés fondamentales des citoyens. À ce titre, et en vertu des dispositions de la Charte africaine des droits de l'homme et des peuples, notamment ses articles 4 et 9, le Conseil national des droits de l'homme d'Algérie a entrepris une série d'activités dans le cadre du mandat dévolu aux institutions nationales des droits de l'homme en matière de protection des droits de l'homme en relation avec la lutte contre la pandémie de la COVID-19. Donc, depuis le 13 mars 2020, en raison des restrictions liées à la crise sanitaire majeure causée par la pandémie de la COVID-19, le Conseil national a organisé ces activités par visioconférence afin de maintenir une consultation régulière et constante avec les membres du bureau permanent et les acteurs institutionnels et non institutionnels activant dans le domaine des droits de l'homme. Le nombre important de sujets liés aux droits de l'homme et aux libertés fondamentales qui ont émergé fortement sur la scène nationale et leur diversité ont représenté autant de défis qui ont permis au Conseil national de pouvoir évaluer la volonté des pouvoirs publics de traduire sur le terrain les obligations et les exigences internationales et régionales y afférentes. Monsieur le Président, honorable commissaire, distingués délégués, le Conseil national a également assuré des interactions par courriel avec le Haut Commissaire aux droits de l'homme des Nations Unies, l'Alliance mondiale des institutions des droits de l'homme, GANRI, le réseau africain des institutions des droits de l'homme, le RINAD, le réseau arabe des institutions des droits de l'homme et les titulaires de mandat au titre des procédures spéciales. Tout en soulignant les dimensions des droits de l'homme en pleine crise sanitaire mondiale, le Conseil national a adopté une approche pragmatique en mettant en œuvre plusieurs actions sur le terrain et à travers les réseaux sociaux. Le Conseil national qui accorde un intérêt particulier et soutenu aux personnes vulnérables a effectué des visites dans des établissements pénitentiaires, des locaux de la garde à vue, de la police judiciaire et des centres d'accueil pour personnes âgées et pour enfants. En outre, le Conseil national a renforcé ses liens de communication et d'information avec les organisations de la société civile, ainsi qu'avec ses délégations régionales et ses correspondants locaux répartis sur l'ensemble du territoire national, à l'effet de détecter toute atteinte aux violations des droits de l'homme et de s'assurer au niveau de leur respect au cours de cette grave pandémie. En matière de communication sociale, le Conseil national s'est exprimé au niveau national publiquement et à maintes fois sur différents sujets d'actualité liés au respect des droits de l'homme dans le cadre de la lutte contre la pandémie Covid-19. Dans ce contexte, le Conseil national a organisé au cours du premier trimestre de l'année 2021 2 conférences nationales sur l'impact de la Covid-19 sur les droits de l'homme. La première conférence s'est tenue le 7 février 2021 à l'université de Béchar, sud-ouest de l'Algérie, en présence de praticiens de droit, de professionnels de la santé et des étudiants. L'objet de cette conférence a tourné autour de la question du respect des droits de l'homme par rapport aux dispositifs de prévention et de lutte contre la pandémie mis en place par les pouvoirs publics. Les mesures prises ou à prendre dans le cadre de ce dispositif ne doivent en aucun cas constituer une atteinte aux droits fondamentaux des citoyens et des libertés publiques consacrées par la Constitution. Les différents intervenants mettent l'accent sur l'impératif du respect des droits fondamentaux et des libertés publiques, et les mesures obligatoires ne devraient avoir lieu que par le recours à une loi d'urgence sanitaire débattue et adoptée par le Parlement. Quant à la deuxième conférence nationale, elle a eu lieu le 24 février 2021 à l'université de Biskra, sud-est de l'Algérie, et a porté sur le procès équitable à l'épreuve de la pandémie de la Covid-19. La Constitution algérienne a consacré dans son article 41 le droit à un procès équitable. Les droits et principes du procès équitable, même si on a recours à la procédure de procès à distance par visioconférence, ont été affirmés à l'exemple du droit de tout accusé de disposer du temps et des facilités nécessaires à la préparation de la défense, du droit de se défendre soi-même ou d'avoir recours à l'assistance du conseil de son choix pendant la garde à vue vers l'instruction et le jugement. Les différents intervenants ont mis en relief l'utilisation de la visioconférence en matière judiciaire, qui offre en cette période de pandémie de multiples avantages liés au respect du protocole sanitaire et des gestes barrières de prévention et de lutte contre la COVID-19. Le recours aux techniques de l'information et de la communication ne doit pas amener à la déshumanisation de la justice. En effet, la justice n'est pas un service public comme les autres et la procédure ne doit pas être perçue comme une simple technique d'organisation de procès. La visioconférence est compatible avec le droit à un procès équitable. Néanmoins, l'attention a été attirée sur le fait d'être attentif aux garanties qu'entourent son utilisation. Telles sont les principales activités que le Conseil national des droits de l'homme d'Algérie a menées et continue de mener dans le cadre de la lutte contre la COVID-19 dans le strict respect des droits de l'homme et des libertés fondamentales conformément aux principes directeurs édictés par la Charte africaine des droits de l'homme et des peuples et autres instruments internationaux. Merci de votre aimable attention.
Thank you very much. Once again, I wish to welcome the National Human Rights Council of Algeria for joining us for this session of the Commission and also providing us with that update on the work undertaken by the National Council of Human Rights, particularly in relation to the COVID-19 pandemic and its impact on human rights, including issues relating to visits to prisons, rights of the elderly and children in the context of the COVID-19 pandemic, and the two conferences held. And in that respect, I wish to indeed echo and reiterate the point that have been made. That is, it is the requirement of the African Charter and the human rights standards of the Commission that emergency measures need to be adopted following the principles of legality, proportionality, necessity, and therefore we agree with the sentiment that have been expressed that the health emergency needs to be declared by law, adopted, and indeed discussed by Parliament. This is a very important sentiment that we echo and reiterate, and we join you in supporting that sentiment. Thank you very much once again. We have the representative of the National Human Rights Commission of Mali with us. You are most welcome to this 6 days organization of the Commission. You have 5 minutes, please. Thank you.
Merci, Monsieur le Président, honorable commissaire, Mesdames et Messieurs les représentants des organisations non gouvernementales invitées, chers participants. Je tiens tout d'abord à vous remercier pour l'honneur que vous me ferez de participer à cette 68e session de la Commission, qui est une occasion pour la CNDH du Mali de parler de la situation des droits de l'homme en termes de défis, de recommandations et de progrès. L'année 2020 aura été une année éprouvante en matière de droits de l'homme à cause du contexte de crise multidimensionnelle que connaît notre pays depuis 2012 et qui est un terreau fertile à de multiples abus et violations des droits humains. En matière de droits civils et politiques, les droits à la vie et au respect de l'intégrité physique ont régulièrement violé. Et la crise multidimensionnelle que connaît le pays est caractérisée par de graves violations et abus des droits de l'homme, parmi lesquels les atteintes au droit à la vie et au respect de l'intégrité physique, qui constituent presque le quotidien, notamment dans les zones affectées par la crise sécuritaire. Dans ce contexte, la défense du droit à la vie et le respect de l'intégrité physique passe nécessairement par la mise en œuvre concomitante des politiques de protection des personnes et de leurs biens et la lutte contre l'impunité. Nos forces de défense et de sécurité sont souvent accusées d'exactions, d'exécutions extrajudiciaires, notamment dans les centres du pays. La CNDH déplore aussi l'usage excessif de la force ayant causé des atteintes au droit à la vie et au respect de l'intégrité physique lors de la crise socio-politique, notamment à Bamako, au cours des événements du 10, 11 et 12 juillet 2020, à Sikasso et à Kaye. Honorable Président, la pratique de l'esclavage par ascendance est persistante au Mali. Les vues de traitement discriminatoire, inadmissible et attentatoire à leur dignité d'homme libre, notamment sous forme de sévices corporels, de tortures psychologiques, de mesures vexatoires, humiliantes, d'atteinte à la liberté de circulation, à la liberté de mariage, au droit de propriété, au droit à la santé, au droit à l'éducation, bref, à la violation systématique des droits fondamentaux des personnes sous sujétion. La CNDH déplore des atteintes au droit à la vie de 4 personnes et au respect de l'intégrité de plusieurs autres, toutes victimes de l'esclavage par ascendance dans la région de Kaye. L'avant-projet de loi de lutte contre l'esclavage et les pratiques assimilées n'a toujours pas connu d'évolution. Nous appelons le gouvernement à redoubler d'efforts pour faire cesser les violations et les abus graves liés à la pratique de l'esclavage par ascendance au Mali. Honorable commissaire, la CNDH, la Commission nationale des droits de l'homme du Mali, déplore aussi des arrestations extrajudiciaires de personnalités publiques soupçonnées de déstabiliser le régime, même si le dossier a été judiciarisé finalement. En matière de droits économiques, sociaux et culturels, le droit à l'éducation au Mali est sérieusement affecté à cause de l'insécurité grandissante dans certaines régions où les écoles sont fermées sur menaces et ou attaques de groupes armés terroristes. En matière de droit à la santé, la jouissance du droit à la santé demeure un défi majeur en raison notamment de l'inaccessibilité des services de santé, les plateaux techniques dégradés, la grève récurrente du personnel de santé, surtout de l'insuffisance des mesures de riposte contre la COVID-19. En matière de droit à la femme, les efforts réalisés par le gouvernement malien ne doivent pas cacher les difficultés majeures qui freinent la jouissance effective des droits de la femme, telles que l'absence de loi réprimant les violences basées sur le genre, l'application effective de la loi numéro 052 sur la promotion du genre, la persistance de certaines pratiques traditionnelles, notamment dans les milieux où sévit le phénomène de l'esclavage. La CNDH déplore le blocage de l'avant-projet de loi sur les violences basées sur le genre au niveau du Conseil des ministres en raison d'une forte pression de certains leaders religieux. En matière de droits de l'enfant, en dépit des efforts réalisés par le gouvernement malien, des enfants sont victimes de graves abus et violations de leurs droits fondamentaux, notamment dans les zones de conflit, enrôlement d'enfants, dans la rue, dans les zones aurifères, etc. Honorable Président, la CNDH recommande la poursuite des politiques de sécurisation des personnes et de leurs biens dans le strict respect des droits de l'homme et du droit international humanitaire. La poursuite de la lutte contre l'impunité en diligentant notamment les enquêtes sur les événements du 10, 11 et 12 juillet sur le massacre d'Ogosagou 2. La CNDH recommande l'adoption de l'avant-projet de loi sur les violences basées sur le genre, la diligence de l'avant-projet de loi réprimant les pratiques de l'esclavage et la révision de la loi d'entente nationale. Merci, Monsieur le Président. Honorable commissaire.
Thank you very much for that statement of the National Commissioner of Human Rights of Mali, providing us update on a range of human rights issues in the context of what the National Human Rights Commission of Mali considered to be the multidimensional crisis affecting Mali since 2012, covering issues relating to civil and political rights, including violations affecting the right to life and physical integrity of the person, issues relating to extrajudicial executions, and excessive use of force by security forces, particularly in the center of the country, including in Bamako, leading to the loss of lives, the persistence of slavery and similar practices affecting the dignity of people who are subjected to these practices, extrajudicial arrest of prominent people, and then in the economic, social, and cultural rights, closure of schools, lack of access to health services, including the disruption of health services due to strike of health workers, and a number of issues relating to women's rights, including the absence of a law preventing gender-based violence, and then an effective implementation of law number 52, and the call that have been made
Sorry, Commissioner Nubu, I think we've lost Commissioner Deso.
the independent. My line was interrupted. Do we have the representative of the medical legal unit?
Thank you, Mr. Chair. Thank you, Mr. Chair, for the opportunity to present this statement on behalf of the Independent Medical Legal Unit in collaboration with TASC, that is Torture, Abolition and Survivors Support Coalition International. Honorable Chairperson, Honorable Commissioners, State Delegates, representatives of national human rights institutions, members of civil society organizations, and distinguished participants. We are submitting this statement based on the events that happened in Uganda during the last presidential elections as researched and reported by TASC, after interviewing and receiving reports from more than 300 survivors of torture and citizen journalists in Uganda. We are grateful for the opportunity to deliver this statement based on TASC's newly published report, Torture in Uganda, the Tragic History, Impact, and Current Reality.
Excuse me, Annie. You have made a statement, right? At Medical Legal Unit previously?
Yes, we have, Mr. Chair, and we had requested.
Okay. All right. I would like you to contact my colleagues in the Secretariat, all right?
Okay.
Otherwise, we have a serious problem of using the platform more than once, and that's not the way we should be working. So
okay.
Thank you for that.
Apologies, we had put in our request, but we'll follow up. Apologies, thank you.
For that, may I now to the next Article 19 East Africa. Article 19 East Africa. Colleagues in the Secretariat, kindly leave out those institutions that have already made their statements from the list. Do you have Article 19 East Africa? No, okay. How about ER&D Institute? ER&D Institute. This is the NGO with observer status 498. Okay. Next on the list is Equality Now. Okay, you are welcome, Mr. Innocent. Your mic is off. Your mic is still off. Micro, please.
It's okay?
Yes, you are welcome again, and you have 5 minutes, please.
Thank you. Honorable Président de la Commission africaine des droits de l'homme et des peuples, honorable commissaire, distingués délégués en vos rangs et titres et qualités respectives, l'Organisation Environnement, Ressources naturelles et Développement profite de cette tribune de la Commission pour faire un état des lieux de la situation des droits des peuples autochtones pygmées des communautés locales en RDC. Elle porte à l'intention de la Commission qu'en date du 17 avril 2021, l'Assemblée nationale a adopté la loi portant principes fondamentaux relatifs aux droits des peuples autochtones pygmées en RDC, qui a été envoyée au Sénat pour la seconde lecture avant sa promulgation par le président de la République après avis de la Cour constitutionnelle. Il faut signaler que c'est un résultat de long processus de plaidoyer mené par les organisations de la société civile. Une fois cette loi promulguée, nous exhortons la RDC à mettre en œuvre la loi pour corriger les injustices historiques et la marginalisation subie par les peuples autochtones pygmées et pour garantir le respect de leurs droits, y compris l'accès à la terre et aux ressources naturelles, aux services sociaux de base et à la justice. Fort malheureusement, cette loi, en vertu du principe de la non-rétroactivité, ne traite pas la situation des communautés pygmées, à l'occurrence les Batwa du parc de Kaouzi-Biega, dont leurs terres ont été expropriées et dépossédées sans consultation ni indemnisation adéquate avant son entrée en vigueur. En dépit de cette avancée politique tendant à la reconnaissance des droits des pygmées en RDC, la situation demeure préoccupante, particulièrement s'agissant de l'accès à la terre, qui est une source de revenus pour ces communautés. La situation se détériore davantage dans le secteur de la conservation de la nature, de l'exploitation industrielle des forêts, ainsi que de la gestion des terres coutumières en RDC. Dans la province du Sud Kivu, les pygmées expulsés du parc national de Kaouzi-Biega continuent de subir la violence des gardes-parcs et des militaires des forces armées de la RDC lorsqu'ils tentent de revendiquer leurs droits à leurs terres coutumières. Nous ne citerons ici que quelques-unes des situations déplorables rapportées au cours des 6 derniers mois. En date du 30 novembre 2020, des violences entre pygmées et militaires des forces armées de la RDC ont été rapportées à Kabamba, où certains jeunes pygmées du village de Lemer à Kalehe ont organisé une marche pacifique qui a été réprimée violemment par l'armée, causant ainsi des morts et des blessés dans les rangs des pygmées. On a déploré ce jour la mort par balle de 3 pygmées. En date du 5 décembre 2020, les pygmées Machine Kafunzi du village de Gouziralo, défenseurs des droits à la terre de son état, qui se rendaient à Kavumo pour se ravitailler en produits vivriers, s'est vu arrêté et détenu avant d'être relâché le soir par les militaires qui ont lui ravi téléphone et carte d'identité. Le matin du 9 décembre 2020, des violences entre pygmées de Bougamanda et des militaires des forces armées de la RDC ont été signalées, causant ainsi des déplacements de la population, la destruction de leurs maisons, ainsi que l'arrestation de certains membres de leur communauté. Depuis la fin de mars 2021, les affrontements sont orchestrés par les groupes armés étrangers et d'autodéfense, dont le Congrès national pour le renouveau et la démocratie, CNRD, qui est un groupe armé dissident des Hutus rwandais, les Nyatura, les Raïa Mutomboki, qui exploitent les minéraux dans les parcs de Kaouzi-Biega, ciblant l'armée régulière, ont été signalés dans les villages pygmées des hauts plateaux de Calais. Selon plusieurs sources concordantes, ces affrontements ont touché des civils et causant ainsi des morts entre les populations. On signale également des déplacements des populations ainsi que des violations des droits de l'homme. C'est pourquoi RND attire l'attention des autorités congolaises et de la Commission des droits de l'homme pour que des actions urgentes soient entreprises conformément aux lois de la RDC, à la Charte africaine et aux autres instruments juridiques pertinents en vue de protéger ces peuples en voie de disparition. RND recommande alors aux autorités congolaises de protéger les pygmées contre les violations des droits dont ils sont victimes, tout en œuvrant pour la paix dans leur village, de mener des enquêtes pour établir les responsabilités et conduire les auteurs devant la justice. Adopter une politique de conservation de la nature qui reconnaît les droits des pygmées. À la Commission de rappeler à la RDC ses obligations découlant de la Charte africaine à travers les recommandations ici de sa décision sous la communication 588/15. Compte tenu de la détérioration de la situation sur le terrain, nous exhortons également humblement la Commission à se prononcer sur les mérites de la communication dès que possible. Merci et je vous remercie.
Thank you for that statement of AR&D Institute in the DRC, drawing the attention of the Commission on the situation of the rights of the pygmies in the DRC. First, noting the welcome development of the adoption of a national law on the rights of indigenous peoples in the DRC, which we very much welcome, as it sets an example for others to follow. And we wish to congratulate the DRC, but also urge them to ensure its full and effective implementation. And the issues of violence and conflict affecting pygmies in various instances that have been highlighted in the statement, issues relating to the fact that this new law doesn't cover the Batwa, as well as conservation, the need for conservation policy, and follow up on communication 558 forward 15. Thank you very much for that statement. May I now invite Equality Now to take the floor? Okay, we have the representative of Equality Now with us. In the interest of time, may I indicate that the next is International Federation for Human Rights. Equality Now is the NGO with observer status 281. You are most welcome. Good to see you again. Please, you have 5 minutes.
Honorable Chairperson of the ACHPR, Commissioners, State Party representatives, fellow civil society representatives, honored participants. Honorable Chairperson, Equality Now's attention has been drawn to reports of sexual violence against women in the conflict-hit Tigray region of Ethiopia. These reports have been raised by the United Nations Office of the Special Representative on Sexual Violence in Conflict and have been characterized as a systematic use of sexual violence as a weapon of war. The Federal Republic of Ethiopia is a signatory to several international and regional human rights treaties, including the African Charter and its Protocol on the Rights of Women in Africa. We therefore invoke the ACHPR's mandate to protect the rights of women in the Tigray region and urge the Commission to urgently set in motion the mechanism for the Special Rapporteur on the Rights of Women in Africa and the Commissioner Rapporteur for Ethiopia to establish an immediate inquiry into the allegations and collaborate with relevant regional, national, and global actors responsible for the promotion and protection of the rights of women to redress any violations in the Tigray region. Further, we appeal that the Special Rapporteur urge the relevant authorities to put in place measures to ensure that women and girls in the region are protected from rape and sexual assault in line with Ethiopia's human rights obligations. Honorable Chairperson, progress is being made towards ending FGM. In the last 3 decades, Africa has witnessed a reduction in the prevalence of female genital mutilation, particularly in the last 10 years. Despite these efforts, the continent still has a long way to go in achieving full eradication of FGM. Demographic trends, particularly population growth, will increase the prevalence of FGM and the number of girls who have undergone the practice over time. There's also the threat of the COVID-19 pandemic, which has increased the risk of FGM as the spread of the pandemic has led to the rise of gender-based violence in many countries. It is estimated that 2 million girls may not be protected due to interruption of anti-FGM programs occasioned by the COVID-19 pandemic. The practice of cross-border FGM is also another area of concern that requires strong action. Even though there are a number of countries with national legislation criminalizing FGM, there's a high incidence of movement of families and circumcises across borders for the purpose of evading prosecution. The lack of regional and national laws to directly address the cross-border aspects of FGM, except in Guinea-Bissau, Kenya, and Uganda, remains a challenge for organizations, activists, and government officials working to tackle the issue. Child marriage, on the other hand, remains an issue not adequately addressed by state parties, and the rapid growth of the child population on the continent makes it increasingly urgent that government accelerate efforts to combat the practice. While some state parties' laws have set 18 years or 21 years as the minimum age of marriage without the requirement of judicial or parental consent, some state parties allow girls to be married under the age of 18 with the consent of the parents or via judicial consent. Implementation of laws prohibiting child marriage is underwhelming, with most perpetrators avoiding prosecution, and in some cases where prosecution takes place, charges that carry lower penalties are filed. Decidedly, most state parties do not implement programs specifically aimed at preventing child marriage by changing social and traditional norms. We call on state parties to enact laws against FGM and child marriage in line with the Banjul Charter, the Maputo Protocol, and the African Charter on the Rights and Welfare of the Child. We also call state parties to adopt a multi-sectoral approach towards ensuring enforcement of legislation, ending FGM and child marriage, both at regional and national level. The approach would successfully bring together relevant state actors to coordinate national programs to end FGM and child marriage through certain approaches, such as targeting pooled resources, as well as knowledge sharing. We also urge states to address cross-border trends and dynamics in the area of FGM, including the need for harmonizing laws, strengthening cross-border law enforcement, and strengthening cross-border community awareness and surveillance. We call on states to harmonize their national marriage laws to absolutely and unequivocally prohibit marriage under the age of 18 years. We call on states to ensure that child marriage cases are promptly investigated and perpetrators prosecuted to the fullest extent of the law, taking into consideration that many child marriage cases also involve sexual and other forms of abuse. We call on states to develop and implement programs aimed at changing social and traditional norms, aimed at preventing child marriage, such as undertaking intensive and consistent public awareness raising.
All right, your time is up.
Thank you, Commissioner.
All right, thank you for that statement of equality now, highlighting sexual violence issues raised in relation to the conflict in the Tigray region of Ethiopia, and calling on the special mechanisms of the Commission, including the country rapporteur as well as the special rapporteur on the rights of women, to take initiatives in that respect. Issues relating to female genital mutilation, despite progress having been achieved on the continent, that this phenomena is not totally eradicated. And the situation has been exacerbated by the COVID-19 pandemic, which disrupted FGM prevention-related activities, leading to 2 million girls who might have been affected as a result. And other issues relating to cross-border aspects of FGM, child marriage, have also been highlighted. May I now give the floor to the National Coalition of Human Rights Defenders, Kenya. This is the NGO, which, as you may recall, I gave the floor earlier, but since they changed their statement after the initial submission, we have agreed that they will come back after they submitted their updated statement. Okay, there you are. You are welcome. You have 5 minutes, please.
Thank you, Honorable Chair, for giving us this opportunity and indulging us to do the statement. Mr. Chair, Honorable Commissioners and fellow delegates, human rights defenders play a critical role in society in the protection and promotion of human rights, which is integral to the success of this commission and human rights instruments in various levels. Since the last session of this commission, the National Coalition of Human Rights Defenders in Kenya, which is popularly known as the Defenders Coalition, has been monitoring the situation and operating environment of human rights defenders in Kenya, and would like to bring the attention of the Commission the following issues on the strict civic space and safety concerns. One is the threat to freedom of association. Due to the COVID-19 mitigation measures introduced by the government of Kenya since March 2020, there continues to be sustained limitations to freedom of association and attacks on institutions and minority groups. On 7th April 2021, police invaded the Communist Party of Kenya office and arrested 12 people, among them HRDs, who were organizing for demonstration against locking down the country without relief measures to cushion Kenyans against the effect of COVID-19. They accused the party of organizing a demonstration against the government guidance combating the spread of COVID-19. There continues to be attacks against the LGBT community, with some influential quarters blaming them on the outbreak of spread of COVID-19. Such assertions have left SOGI, HRDs, and organizations vulnerable to attacks that include breaking into their offices and homes, threats, intimidation, and evictions from their residences. The next item is on the freedom of expression. In light of the severe restriction to the right to assemble, individuals that resorted to use different forms of expression, expressing their concerns, especially social media platforms, were targeted for arbitrary arrests and malicious prosecutions. The Computer Misuse and Cybercrime Act was severely used to criminalize bloggers, journalists, and members of public that use this platform of advocacy. Freedom of the media, information expression continue to be one of the vulnerable areas of HRDs as the their power to communicate is being stifled. Another item is on the rate of freedom of assembly, demonstration, and picketing. Increased attacks on HRDs to continue to be recorded within the period, with Article 37 on it to assembly recording the highest number of violations. The period saw that 7 human rights defenders charged with, among others, contravening COVID-19 regulations. This came after HRDs attempted to speak against human rights violations occurring in the country with regard to misappropriation of COVID funds and institutional malpractices. Another gross interventions we need here is the right to security of person, whereby human rights defenders working on environmental rights, holding business and corporation into account, and those working on land matters found themselves in constant conflict with the law. Arbitrary arrests and prosecution arising from trumped-up charges was regularly used against HRDs in Murang'a, Kilifi, and Kwale counties. A National Arts Commission official who was a key witness in a corruption-related matter was found murdered on 15th March 2021. On 8th December 2020, an activist from Njoro, Nakuru County, Paul Dirango, was found murdered and his body dumped in the Rugo River in Nakuru. He had earlier on reported 2 cases of threat to his life in the area police station. Although the Director of Criminal Investigation claimed they had commenced investigation to the case, there has been no reported progress in the investigation. The HRD community is apprehensive that the state has no intentions to arrest and hold the killer of the HRD to the account. Missing Voices Coalition has documented various cases of enforced disappearances and extrajudicial killings of people during the enforcement of law and government directives. This has created an environment of fear among HRDs with serious impact in the promotion and protection of human rights in the country. Item 5 is on independence of the constitutional commissions. Independent commissions like the Kenya National Commission on Human Rights, mandated to hold the government accountable on the protection and promotion of human rights, continue to operate without commissioners and with limited funding. Recommendations: the government of Kenya honestly conclude the investigation of the killing of Paul Dirango and publicly pronounce the progress of investigations. That the government supports efforts for the implementation of the Bill of Rights in the constitutions and protect HRDs from attacks and CSOs from threats of deregistration and other administrative functions. The African Commission on People and Human Rights to come up with a resolution to compel the government of Kenya to ensure safety and security of human rights defenders in Kenya and in the region, especially the East African region. The government of Kenya to advertise and recruit commissioners for the Kenya National Commission on Human Rights. Thank you, Mr. Chairperson.
Thank you for that statement of National Coalition of Human Rights Defenders in Kenya, drawing the attention of the Commission on the shrinking space and threats affecting human rights defenders in particular, including in the context of the March 2020 COVID-19 measures adopted by government, which results, whose enforcement is affecting, as reported, those various rights relating to freedom of association, leading to the arrest of some people from the Communist Party of Kenya, affecting the rights of LGBTI community, and arrest of human rights defenders using the social media platform, the impact of COVID-19 regulation, again, on freedom of assembly, and reports of the killings of human rights defenders, including the lack of investigation, other issues of extrajudicial killings. And finally, the independence of constitutional commissions that have been brought to our attention. We thank you for that, and we have taken due note of all of these, and myself, other country rapporteur, and colleagues in their thematic responsibilities would certainly also look into this. And if we have the representative of Kenya with us, of course, we would be happy to hear their voice on these issues as well. Now it is a few minutes past, half past, is it 11? 10, half past 10 GMT. It is time for taking a health break. We will be back at 11:30 GMT. Have a healthy break, colleagues and distinguished delegates. We'll be back in 1 hour. Thank you very much. Good afternoon, colleagues, distinguished delegates. May I call this session to order again? If we are all set, dear colleagues and distinguished delegates, we will proceed to the next statement. I'm not really sure if we have received any statement from states parties or national human rights institutions, or if we have Ambassador Mackay of South Africa with us. The next, as you recall, I indicated that the next on the list is the International Federation for Human Rights. If we have the representative of International Federation for Human Rights, this is the NGO with observer status number 22. Okay, I understand that Mr. Andrew Songa is with us. After FIDH, we have Alliance for Africa next. Alliance for Africa next. After that, it is OMCT, World Organization Against Torture. We are having a connection problem with FIDH. We will give the floor to FIDH when we have a firm connection. If we have the representative of Alliance for Africa, this is the NGO with observer status 235. I have seen an indication that the representative of Alliance for Africa is with us.
Good morning.
Okay, very good morning and good afternoon to those of us in East Africa. Most welcome once again. Good to see you. You have 5 minutes.
Okay, this is a statement by Alliances for Africa at the 68th Ordinary Session of the African Commission on Human and People's Rights, Observer Status number 235. Honorable Chairperson of the ACHPR, Alliances for Africa is an international African-led non-governmental organization working in the areas of human rights, peace, and sustainable development. AFA, as we are known, works with partners in and around and beyond the continent of Africa. AFA is a member of the Solidarity for African Women's Rights, a coalition of over 60 organizations working on women's human rights in 32 countries in Africa. SOA was formed with the principal objective of advocating for the ratification, domestication, and implementation of the protocol to the African Charter on Human and People's Rights on the Rights of Women in Africa, the Maputo Protocol, which was adopted 17 years ago. Honorable Chairperson, as the global community begins taking steps towards an economic and social recovery in the wake of the COVID-19 pandemic, Alliances for Africa and the SOA Coalition calls upon the African Union and its member states to apply a human rights-based approach to these post-COVID-19 recovery efforts. Specifically, we urge the African Union and its member states to take into serious consideration the gendered effects of the COVID-19 pandemic. In particular, the disproportionately harmful effects of the pandemic on the rights of women and girls in Africa. We urge the Commission to develop guidelines on human rights-based and gender-sensitive approaches when it comes to government-led efforts aimed at the post-COVID-19 economic and social recovery. Along the lines of earlier guidelines by the ACHPR on promoting similar approaches on the question of combating the pandemic. These proposed guidelines will take into consideration the need for increased resources, focus, and attention on the disproportionate effect of the COVID-19 pandemic on the social and economic rights of women, their rights to live free of violence and discrimination, as well as their rights to live in a positive cultural context free from the risk of harmful traditional practices. Honorable Chairperson, our attention has been drawn to reports of sexual violence against women in several parts of Ethiopia at present, but with particular concern to the conflict-hit Tigray region of Ethiopia, given the gravity and the scale of the violations, as well as the presence of foreign troops, thus warranting coordinated national, continental, and international responses to address the situation. These reports have also been raised by the United Nations Special Representative on Sexual Violence in Conflict and have been characterized as a systematic use of sexual violence as a weapon of war through its use as both a strategy and a tactic of conflict and coercion. The horrendous survivors' accounts from the Tigray region of sexual abuse of civilians only serve to confirm that there is nothing inevitable about this brutal state of affairs. The Federal Democratic Republic of Ethiopia is a signatory to several international and regional human rights treaties, including the African Charter and its Protocol on the Rights of Women in Africa. We therefore invoke the ACHPR's mandate to protect the rights of women in Tigray and other regions in Ethiopia where there is active conflict and women and girls' safety has been compromised, and urge the Commission to urgently set in motion the mechanism of the Special Rapporteur on the Rights of Women in Africa and the Commissioner Rapporteur for Ethiopia to establish an immediate inquiry into the allegations and collaborate with relevant national, regional, and global actors responsible for the promotion and protection of the rights of women to redress any violations of women's rights in the Tigray region, including through prosecutions under international criminal law. This inquiry needs to extend to violations committed by all parties, including Eritrean forces in Tigray. Further, we demand that the Special Rapporteur on the Rights of Women in Africa urge the relevant authorities to put in place measures to ensure that women and girls in the region are protected from rape and sexual assault in line with Ethiopia's human rights obligations, and take all steps necessary to address and mitigate the harm to victims of sexual violence that have already occurred through a survivor-centered approach. Honorable Chairperson, African Union member states committed to achieve universal ratification of the Maputo Protocol by 2020. Regrettably, to date, 4 months after the end of the African Women's Decade, 13 AU member states are yet to ratify the Maputo Protocol. We urge the remaining 13 AU member states, Botswana, Burundi, Central African Republic, Chad, Egypt, Eritrea, Madagascar, Morocco, Niger, Sahrawi Arab Democratic Republic, Somalia, South Sudan, and Sudan to urgently ratify the Maputo.
Your time is up.
It's just the last sentence.
Okay, please continue.
Concerning that only 16 of the 42 state parties to the Maputo Protocol have reported on the Maputo Protocol. Thank you.
Thank you for that statement of Alliances for Africa, which provided us update on the state of affairs relating to the rights of women in Africa. Also, in particular, putting emphasis on the need to take account of the gender dimension of the impact of the COVID-19 pandemic and the need for a human rights-centered approach to the effort in the social and economic recovery from the impacts of the COVID-19 pandemic, having regard to the gender dimension of the adverse consequences of the pandemic. And wish, of course, to indicate to all NGOs and states parties that the Commission already anticipating all of these issues have adopted Resolution 449, and we urge civil society organizations to make use of Resolution 449 as part of their campaign and advocacy for a human rights-centered approach to the recovery from the COVID-19 pandemic. This is also welcomed by the AU Assembly as well. It is one of the few resolutions of the Commission to be welcomed at that level. We also take note of the serious issues relating to sexual violence in the Tigray region of Ethiopia, including acts of violence perpetrated by foreign troops present in the region. We wish to extend our solidarity with all women and girls who were caught up in these barbaric acts of sexual violence. And indeed, we reiterate the need for accountability, as have been also said yesterday by the Ethiopian Human Rights Commission, including by all actors involved in this conflict situation. We also take note of the need for redress, including a survivor-centered approach to redress. Finally, two issues relating to the Maputo Protocol. One is universal ratification. The deadline was 2020, it has passed. So what is it that we at the African Commission and states parties to the African Commission need to do in order to ensure that the remaining 13 states would ratify the Maputo Protocol? And the rate of submission of reports under Article 26 of the Maputo Protocol also increases. Thank you once again for that statement. Next, as I said, is International Federation for Human Rights. I hope we are able to connect now.
Thank you, Chair.
If you could switch on the video as well. Okay, welcome, Mr. Andrew Songa. You have 5 minutes, please. Thank you.
Honorable Commissioners, Chairperson, State Delegates, National Human Rights Institutions, and my fellow participants. The International Federation for Human Rights appreciates the opportunity to address you on this occasion of the 68th Ordinary Session. While the global COVID-19 pandemic continues to perpetuate a health, economic, and social crisis that has severely impacted livelihoods and amplified existing concerns on peace and security on the continent, significant progress has been made in developing vaccines to combat this pandemic. Yet, FIDH is deeply concerned by the geopolitically induced inequity that has characterized the access to this vital resource. Despite the ongoing COVAX initiative, which seeks to make access to the vaccine equitable, Africa has been a recipient of only approximately 4.5% of the vaccine doses administered worldwide. It is for this reason that FIDH stands with the Commission and member states such as South Africa in calling for a waiver on the application of intellectual property rights on these vaccines as a means of securing states' obligations to take all the necessary measures to ensure the right to health in the midst of this pandemic. Alongside these efforts to enhance access to COVID-19 vaccines, we call on member states to strengthen the capacities of their health sectors by rededicating themselves to realizing the Abuja Declaration pledge of allocating at least 15% of their annual budgets to improve the health sector. On the aspect of the continent's economic recovery and the negotiation of assistance and stimulus packages, FIDH continues to insist that providing social safety nets for vulnerable groups must remain a high priority as a way of mitigating the loss of livelihoods and ensuring access to basic necessities such as food, water, and proper sanitation. Honorable Commissioners, FIDH and its member organizations continue to monitor electoral processes across the continent and remain deeply concerned by the violations encountered by citizens wishing to simply exercise their democratic rights. We deplore and condemn the violations that were committed during Uganda's January elections, which included the excessive use of force by law enforcement agents, resulting in the arbitrary arrests, detentions, and killing of civilians, as well as internet restrictions. In the Republic of Congo, the political opposition, as well as human rights activists and journalists, have been regular targets of attacks and obstructions, such as human rights defenders Mr. Alexandra Ibaka Zabana and Mr. Chris Dongui, as well as the journalist Mr. Raymond Malonga, being arbitrarily detained and arrested. In Djibouti, our organization deplored the continuous shrinking of political space, preventing any effective political debate and political opposition. Illustratively, Mr. Daher Ahmed Farah was deprived of his right to stand for elections because of the government's failure to comply with the United Nations Human Rights Committee decision to restore his political party. In Chad, FIDH denounced the run-up to the presidential election of 11th April in terms of the systematic muzzling of all voices in favor of democratic change that had characterized the government in power over 30 years. We strongly condemn the undue restrictions to democratic space and the various grievous acts of human rights violations that have occurred before, during, and after these elections. We encourage the Commission to remain seized of these situations and call on state parties to refrain from any further acts that violate or unduly restrict human rights and fundamental freedoms, to immediately release individuals arbitrarily detained or arrested, including from the political opposition, and to urgently investigate all human rights violations and prosecute the alleged perpetrators regardless of whether they are state or non-state actors. We also strongly advocate for a continental dialogue on the state of elections in Africa, one that can foster electoral reforms which include enhancing the independence of electoral commissions, prohibiting the undue use of state resources in election campaigns, and ensuring judicial remedies for electoral disputes. On the critical issue of human rights in conflict situations, we continue to track the tragic developments in Ethiopia, but welcome the government's recent undertaking to submit to independent investigations as conducted by this commission, as well as the Ethiopian Human Rights Commission and the United Nations Office of the High Commissioner for Human Rights. We insist that these investigations must be credible accountability processes anchored on full cooperation by the state authorities and those responsible for non-state armed groups. We further reiterate our call for inclusive national dialogue as a way out of the unfolding crisis and to establish a comprehensive roadmap for addressing the underlying grievances and creating conditions for peace, security, and democratic and socioeconomic transformation. In the Sahel region, it is reported that the complex network of international and national security forces and armed terrorist groups that are present there have been the perpetrators of human rights violations to varying degrees. In Niger, January 2021 saw over 100 people killed in the Tillaberi region, while March 2021 saw further attacks in this region and the Tawa region, resulting in more than 200 deaths. In Mali, the United Nations Stabilization Mission in Mali published a report on 30th March on the investigation into airstrikes launched by the Bakane Force on 3rd January 2021 on the locality of Bounty. This report revealed that the strikes killed 3 alleged members of armed groups and 19 civilians attending a wedding ceremony, demonstrating the need for a thorough judicial investigation by the Malian and French authorities into these facts, which could constitute—
Your time is up, Andrew.
Just to quickly conclude, Chair, we urge the responsible parties in these conflicts to not only ensure accountability for these deaths, but to also move away from a purely security-driven approach and instead balance this by addressing the equally important basic needs of the local populations, such as the restoration of health, social and educational services. I thank you.
Thank you very much for that statement of FIDH. Dealing with the strategic question of access to vaccine in Africa, highlighting how much Africa is left behind in this respect, receiving only about 4.5% of vaccine, and indicating that this is the result of the current approach to the production and distribution of the COVID-19 vaccine, which is not working in delivering for all those who needs it. And therefore joining the Commission in the call for a waiver of the application of patents relating to the COVID-19 vaccine. A call that many South Africa and India jointly moved, but over 80 countries have joined, and many actors in the international community are also calling for it. The AU adopted a decision on this in February at the Assembly level. Also, we welcome the commitment, the need for states to recommit to the Abuja Declaration for investing 15% of their GDP to the health sector, and also the questions relating to protecting the most vulnerable in this situation through the implementation of social safety net programs, issues relating to election-related human rights issues, including excessive use of force, such as in Uganda, which, by the way, the Commission have issued a statement on, and other countries, including Republic of Congo, Djibouti, and Chad. We also take note of the human rights in conflict situations, as highlighted, relating to Ethiopia, Niger, and Mali. Thank you once again for that. Next is OMCT, World Organization Against Torture. This is the NGO with observer status 5252. If we have the representative of OMCT. Okay, we have the representative of OMCT with us.
Yes.
Next would be Initiative for Social and Economic Rights, but let me give the floor to OMCT. You have 5 minutes, please. Most welcome.
Merci, Monsieur le Président. Monsieur le Président, distingué commissaire, délégué des États partis à la charte et chers participants à cette 68e session de la Commission africaine des droits de l'homme. L'Organisation mondiale contre la torture et son réseau SOS Torture en Afrique remercient la Commission pour cette occasion de soulever certaines questions clés concernant la situation des droits de l'homme en Afrique. Nous faisons cette déclaration conjointe avec notre partenaire au Togo, le collectif des associations contre l'impunité au Togo, au nom des membres de notre groupe d'intervention judiciaire que nous avons créé pour lutter contre la torture en Afrique. La situation des droits humains est restée préoccupante au cours des 6 derniers mois, notamment à cause des persécutions contre les défenseurs des droits humains. Le recours excessif de la force pour réprimer violemment des manifestations politiques et la recrudescence des bavures dans le cadre de la lutte contre le terrorisme dans le Sahel. S'agissant de la situation des défenseurs des droits humains, elle a été caractérisée par des intimidations, des persécutions et même des poursuites judiciaires. C'est le cas au Burundi, où la récente condamnation in absentia à une peine de prison à perpétuité de 12 défenseurs des droits humains en exil, dont Armel Nyongere, membre de l'Assemblée générale de l'OMCT, peut faire une illustration parfaite de cette situation. Ils ont été condamnés alors qu'ils sont engagés depuis plusieurs années à la défense des droits humains, y compris en collaborant avec les organes de traité de la Commission, y compris la Commission africaine des droits de l'homme. Au Soudan, certains défenseurs des droits de l'homme, dont Mme Mohad Bajat et Mme Khalija Aliwadi, ont aussi été victimes de persécutions judiciaires. La situation des défenseurs des droits humains est encore plus à risque dans ces contextes marqués par la COVID-19, où, à cause de leur prise de position, ils risquent de faire la prison. Nous demandons à la Commission d'interpeller les États sur la situation spécifique des défenseurs, notamment ceux les plus vulnérables. L'usage excessif de la force dans plusieurs pays par les forces de police, notamment pendant la crise sanitaire du COVID-19, n'a été ni légitime, ni nécessaire, encore moins proportionnel. Cela a un effet dévastateur sur l'intégrité physique et psychique et peut relever dans plusieurs cas de la torture. Cela est un outil utilisé très souvent lors des manifestations pacifiques des élections. C'est le cas au Niger, où la contestation qui a suivi les élections présidentielles de février 2021 et les restrictions à Internet ont conduit à des manifestations violentes. Les échauffourées qui ont éclaté entre les forces de l'ordre et les manifestants ont conduit à l'usage de la force, notamment au recours de gaz lacrymogène, et a eu pour conséquence 470 personnes arrêtées et 2 morts. Au Tchad, en réponse aux marches pacifiques des partis politiques de l'opposition et de la société civile, réclamant l'annulation des élections présidentielles, les forces de l'ordre ont fait usage excessif de la force, des traitements inhumains et dégradants et d'actes de torture contre les manifestants. En tout, 112 personnes ont été arrêtées, dont M. Maxwell Yonganya, président de la Ligue tchadienne des droits de l'homme, et M. Mahamat Nou, ex-secrétaire de la Convention tchadienne des droits de l'homme. Au Congo, à la République du Congo, avant les élections présidentielles, le docteur Alexandre Ibanga Zabana, un des coordonnateurs de la plateforme congolaise des droits humains, a aussi été arrêté. Au Bénin, les modifications de la Constitution et du calendrier électoral initié par le président de la République en novembre 2019, de même que l'arrestation ou la condamnation d'au moins 17 opposants politiques, ont créé des protestations et des frustrations politiques, conduisant ainsi à des manifestations préélectorales en avril 2021. Ceux-ci ont fait 1 mort et 6 blessés. En plus de l'intervention des forces de police, il y a eu de l'encadrement des forces militaires. Même le Sénégal, souvent considéré comme modèle démocratique en Afrique, a expérimenté en mars 2021 un niveau de violence inquiétant à la suite de manifestations pacifiques réprimées par un recours excessif de la force, faisant ainsi près de 13 morts, environ 590 blessés et 600 personnes arrêtées. L'OMCT se réjouit que la Commission africaine soit intéressée par cette problématique et qu'elle a récemment fait de nombreuses déclarations visant à condamner ces recours excessifs de la force. La recrudescence des bavures au sein des forces engagées dans les opérations de contre-terrorisme dans le Sahel est aussi préoccupante. Les récentes allégations de viols et tentatives de viol sur des civils par des militaires tchadiens engagés au sein de la force conjointe G5 Sahel et en opération au Niger constituent sans équivoque des violations graves du droit international et rappellent l'importance de mettre les droits de l'homme au centre des réponses sécuritaires. De même, au Mali, le 3 janvier dernier, une frappe de la force Barkhane dans la localité de Bounti a tué au moins 22 personnes qui prenaient part à un mariage et blessé 8 autres. Cette situation...
I'm sure you are listening to the time that is ringing. Your
Okay,
time
I'm
is
closing
up.
now. Cette situation montre que le recours à la force armée dans les contextes de lutte contre le terrorisme, lorsqu'ils ne prennent pas en compte les préoccupations des droits de l'homme, mettent à mal la sécurité des civils, et cela devrait être une préoccupation de la Commission au cours de cette session. Je vous remercie.
Thank you very much for that statement of the OMCT, bringing to the attention of the Commission human rights issues in a number of countries, focusing in particular on such matters are excessive use of force by security forces, the arrest of political opponents and civil society organization members, as well as issues relating to torture. Various countries have been cited, including Congo, events in Benin, where the arrest of 17 political opponents led to protests in which the attempt to contain the protests led to 6 people wounded and the unfortunate loss of the life of 1 person. And also events in Senegal in March 2021. Thank you for that statement. We do hope that states parties have listened to that as well. The next is Initiative for Social and Economic Rights. If we have the representative of Initiative for Social and Economic Rights, this is the organization with observer status 490. The next one after Initiative for Social and Economic Rights is CDFDH. CDFDH. Okay, your mic is off.
Yes.
You are welcome, and you have 5 minutes, please.
Thank you. The Initiative for Social and Economic Rights works holistically on social economic rights, and we make this statement a year since COVID-19 was declared a pandemic, which is a point of critical reflection on the situation of socio-economic rights in Uganda. We'd like to commend
We can't hear you.
Oh, can you hear me now?
Yes, now we can hear you better.
Sorry. We specifically commend the adoption of Resolution 449 on human and people's rights as a central pillar of successful response to COVID-19 recovery from its socio-political impacts. We'd like to emphasize the following issues that require further attention and a stronger voice from the Commission. Vaccines. First, the need to waive patents and share know-how to increase supply of vaccines. As has been mentioned, vaccines are widely recognized as essential to relieve strained health systems and the quickest way to economic recovery. Yet vaccine nationalism and patent monopolies have resulted in vaccine apathy, leaving low-income countries, particularly African ones, competing for overpriced leftovers. Uganda and the AU have paid more for the AstraZeneca vaccine than the EU and other developed nations. Proposals by South Africa and Kenya to the WTO last year, now backed by the AU to suspend patents for COVID vaccines, are yet to be approved. This has resulted in limited supply, leaving Africa's health workers and vulnerable workers, people largely unvaccinated. A COVID vaccine is a public good and a human right. We recognize the strong remarks made by the chairperson at the beginning of this session. Would like to have a stronger voice from the African Commission on this as well. We also note the inequitable country rollout of COVID vaccines. While countries like Uganda have received doses through COVAX and have negotiated bilateral deals, we're deeply concerned about how the government is rolling out the COVID-19 vaccination. Despite setting out priority groups, there's been queue jumping right from the start, with privileged and connected individuals prioritized over health workers and older persons. In rural communities in particular, a number of people over 70 years are yet to access a vaccine. Despite the ministry's directive to allow other forms of ID besides national ID following litigation initiated by ISA, we note with concern that sometimes directives issued by local governments have required national IDs. This excludes millions of Ugandans who lack access to national IDs. There is insufficient engagement with communities, resulting in misinformation and vaccine hesitancy. In Uganda, more than a month since vaccination was launched, less than 20% of the vaccines available have been distributed. There's been limited access to information about the price paid for the vaccines, limited access about the total number of doses received, including donations from other countries, and a lack of disaggregated data on how many of the different categories that were prioritized have actually received the vaccine. Limited access to information makes it difficult for citizens and civil society to ensure there is no misuse of limited resources. It also endangers citizens' trust in the vaccination process. The other major issue we are seeing is declining investment in public services. COVID-19 underscored the centrality of public services and revealed we cannot leave social services like health and education to the market. Doing so leaves the poor behind. The declining state investment in these essential public services and increased marketization of public services through arrangements like public-private partnerships and a blind belief in market solutions endangers accessibility of quality public services to all. As a result, Public services like health are often under-equipped. Medical workers in health facilities treating patients with symptoms of COVID-19 have faced enormous challenges, including basics like protective gear, delayed payment of allowances. The country still has a shortage of ICU beds, with the government hastily procuring 108 beds when the pandemic hit to supplement our existing 55 ones for over 45 million Ugandans. With poverty and inequality rising due to the COVID-19 pandemic lingering economic effects, it's important to invest in strong public health systems. States can't relinquish these human rights obligations to the private sector. They must finance and steward these services. And the third one is the unregulated expansion of the private sector. Chronic underfinancing of the health sector and the unregulated expansion of private actors, particularly when they exist in lieu of public options, has been detrimental to the accessibility of healthcare for vulnerable populations. Private facilities continue to violate patients' rights, including charging exorbitant fees and detaining patients who fail to pay. This has also been exemplified with the country's COVID-19 management. While the Ministry of Health accredited private facilities to treat patients, there's been no regulation. As a result, many Ugandans are unable to access tests and treatment because of the high cost of testing and treating COVID-19 in private facilities. Some private facilities have issued fake negative COVID-19 test results for fee. This endangers the country's fight against COVID-19. This all risks being replicated with vaccines, where private providers are now allowed to import vaccines amid scarce global supply, with no requirement to ensure equitable supply, but the country continues to struggle to receive sufficient doses. Curbing the unregulated private actors.
Conclude, please. I'm sure you are listening to the timer.
Yes, all right, sorry. I would like to also add that curbing the unregulated expansion of private actors is key, and Uganda is also very overdue on its report, the African Commission. We call upon the Commission to provide strong guidance to states on private actors and social services, to push for people's vaccine, to recommend Uganda to ensure an equitable rollout of COVID vaccines and address the barriers mentioned above.
Okay, thank you very much for that statement of the Initiative for Social and Economic Rights. Again, speaking to one of the most current topical issues, human rights issues on the continent, and indeed for much of the developing world. And this has to do with what this statement called the vaccine apartheid, resulting from vaccine nationalism and patent monopolies, and the need for considering and having the vaccine as a global public good, as I have called on, in my speech at the beginning of this session. And indeed, the issue of equitable rollout of the vaccine once vaccine has been procured. This is important, and in this respect, the issue of access to information on the number of doses that have been received, on the plan for rollout, and also the number of people receiving and the priorities. I think the lack of access to vaccine indeed is costing with lives and the health of people, including health workers. Health workers are dying because they are not able to receive the most important defense, being on the front line through access to vaccine. We also take note of the issues that have been raised in relation to declining investment in social services by the state, and the commodification of social services, leading to exclusion of citizens from access to social economic rights. The reporting by Uganda, yes, we join you in calling Uganda to submit its state report under Article 62, Article 26 of the Maputo Protocol, and Article 14 of the Kampala Convention. Thank you for that. The next is CDFDH. Do we have the organization with observer status 5 to 5? 5 to 5. Do we have? Okay, we have. While waiting for the representative of CDFDH to join, the next is internationallawyers.org to be on standby. Okay,
Merci,
you are
Monsieur le
welcome.
Président.
You have 5 minutes, please.
D'accord, Monsieur le Président. Monsieur le Président de la Commission africaine des droits de l'homme et des peuples, honorable commissaire, distingués délégués en vos rangs et grades respectifs, sous protocole strictement respecté, le Centre de documentation et de formation sur les droits de l'homme se réjouit de l'opportunité qui lui est accordée de participer à cette session, mais aussi de partager avec vous ses préoccupations sur la situation des droits de l'homme au Togo. Notre pays connaît depuis le mois de septembre 2020 un accroissement préoccupant des restrictions de l'espace civique, plus précisément une restriction des libertés d'association et d'expression. En effet, suite à des plaintes déposées par des acteurs politiques ou sur autosaisine, la haute autorité de l'audiovisuel d'une part et la justice d'autre part ont pris des sanctions disproportionnées contre des médias, des journalistes, des leaders d'opinion et associations. Ces sanctions ont principalement consisté en des peines d'emprisonnement, des suspensions provisoires et définitives de médias et de révocation du numéro d'enregistrement d'une association. Par ailleurs, le CDFDH déclarait lors de la précédente session ordinaire de la Commission que pendant la crise sanitaire, surtout dans la période de couvre-feu, notre dispositif de monitoring a relevé 9 cas d'atteinte au droit à la vie et 21 cas d'atteinte au droit à l'intégrité physique entre mars et septembre 2020. Suite à un plaidoyer de la société civile, des agents des forces de l'ordre et de sécurité ont, selon nos informations, subi des sanctions disciplinaires. Nous avons pu noter que parmi ces agents sanctionnés, certains ont été exclus pour 6 mois et d'autres définitivement exclus. Cependant, nous déplorons qu'aucune action judiciaire n'ait été enclenchée contre les agents responsables des atteintes au droit à la vie et à l'intégrité physique, alors qu'ils ont été mis à la disposition de la justice par le ministre de la Sécurité et malgré les plaintes déposées par les victimes et leurs proches. Par ailleurs, la question de la protection des données personnelles devient de plus en plus préoccupante au Togo. À titre d'exemple, un article publié le 3 août 2020. Dans un article publié le 3 août 2020, les journaux occidentaux Le Monde et The Guardian révélaient, à la suite d'une enquête, que l'État togolais a utilisé un logiciel espion très sophistiqué dénommé Pegasus pour espionner et surveiller des opposants et des leaders d'opinion. Cette situation souligne la nécessité pour le gouvernement de poursuivre et d'accélérer le processus de réforme juridique pour offrir aux citoyens togolais une protection efficace des données personnelles. Eu égard de ce qui précède, le CDFDH invite la Commission à recommander à l'État togolais d'abord de mettre fin aux restrictions et aux sanctions disproportionnées à l'espace civique, de respecter et d'appliquer les dispositions de la Charte africaine des droits de l'homme et des peuples, ainsi que les lignes directrices de la Commission africaine des droits de l'homme et des peuples sur la liberté d'association et de réunion en Afrique, d'ouvrir des procès et prendre conformément à la loi des sanctions contre les membres des forces de l'ordre et de sécurité coupables d'atteinte à la vie et à l'intégrité physique pendant la crise sanitaire, d'accélérer le processus de ratification de la Convention de Malabo à travers l'adoption par notre Parlement du projet de loi validé en Conseil des ministres en décembre 2019, d'opérationnaliser l'instance de protection des données à caractère personnel, IPDCP, conformément au décret du 9 décembre 2019, pris justement en application de la loi du 23 octobre 2019 sur la protection des données à caractère personnel. Monsieur le Président, honorable commissaire, je vous remercie.
Thank you for delivering that statement within the time allocated, actually giving us a few more seconds. These were the statements, particularly referencing to the situation of human rights in Togo, raising concerns as far as the restriction of the civic space is concerned and the impact that this has on freedom of association and freedom of assembly. Also raising concerns relating to the use of force by security personnel in respect to the enforcement of COVID-19 regulations, while welcoming the disciplinary sanctions that were taken against those security forces engaged in excessive use of force. Concern has been raised that as per the requirements of international human rights standards, no criminal investigation and trial have been instituted, and a call has been made to this effect. There was also concern relating to protection of personal data and the need for the adoption of relevant law in that respect. Thank you again for that statement. The next one, as I said, is internationallawyers.org. If we have the representative of internationallawyers.org, the NGO with observer status 436. Thereafter, we have ROADDH. This is the NGO with observer status 398. If we have that, we will give the floor next. First, internationallawyers.org. You have the floor, 5 minutes, please. You are welcome.
Yes, thank you, Honorable Chairperson. Internationallawyers.org takes this opportunity to appreciate the commitment of all commissioners in this challenging time. We also wish to remember several jurists who left us in recent days, including Commissioner Nadaime Gay, Professor Christoph Heinz, and a member of our NGO's advisory board, Ramsey Clark. We salute these individuals' commitment to justice and their contributions to human and people's rights in Africa and around the world. We recognize the continuing threat that COVID-19 poses to the health of Africans. The right to health requires responsible action by African governments, as well as the duty of governments everywhere to ensure that African countries have access to the means to combat this deadly disease. We also know that in some countries, including the United States, asylum seekers from African countries remain detained in conjugate facilities with no ability to protect themselves from contracting the deadly coronavirus, and then they are deported back to their country. This practice may spread COVID-19 to Africa at much faster rate and with more deadly variants. We hope that the states will consider a moratorium on deportation, or in short, any personnel removed to another country we hope that the states will consider a moratorium on deportations, or in short, any person removed to another country is first vaccinated against COVID-19. African states can encourage this in their cooperation agreements with the states outside of Africa. We welcome the Commission's call for cooperation on the report on climate change. We request the concerned commissioners to report on the result of that call, whether and how the work is proceeding, and when it is believed that the report will finally be presented publicly. This crucial step in helping to protect Africans from the adverse effects of climate change deserves the Commission's serious attention. We note for the Commission that the UN Human Rights Council is expected to create the post of a special rapporteur on human rights and climate change, and urge the Commission to consider creating the post of a special rapporteur on human and people's rights and climate change in Africa. We again draw attention to the deteriorating situation of human rights in Egypt, where even during the current deadly pandemic, political prisoners are being detained arbitrarily, denied adequate access to healthcare, and often tortured. These individuals include human rights defenders who are detained because they were lawyers for others, because of their political affiliations or statements, and sometimes merely because of their relationship to political figures. We urge the Commission to take swift and effective action to investigate these claims and to take appropriate action where they are found to be proven to ensure respect of humans and people's rights in Egypt. It would have been 8 years since the unconstitutional change of the government took place in Egypt. The July 2013 coup d'etat was a violation of the right of every Egyptian to participate in their government that is found in Article 13 of the Charter. Whatever the practicalities of the ground, the Commission should ensure that the Charter is respected. Our members have trained numerous Egyptian diplomats in international law and have always been impressed by the language skills of Egyptian diplomats. However, if the language is a barrier in dealing with the Egyptian authorities, we request the Commission offer assistance to Egypt. This can be done by holding public hearings about human and people's rights issues that so many human rights defenders have raised. If held under the auspices of the Commission, the Egyptian authorities can benefit from the highly skilled interpreters of the Commission who can interpret during a hearing. We regret the continuing hostilities in northern Ethiopia, and we call upon the Commission to investigate the actions of Ethiopian government in the north of the country, as well as the involvement of Ethiopian officials from past governments in serious violations of human rights that in fact constitute international crimes. While we welcome the statement of the National Commission of Human Rights in Ethiopia, especially their concern for the protection of civilians, we also note that adequate redress of human rights violations includes the investigation and, if necessary, the prosecution of individuals who have violated human and people's rights or international humanitarian law. Finally, we believe the African Commission is perhaps more necessary today than it has ever been since its creation, and we urge the Commission to act in a manner worthy of the trust Africans have placed in it. For that reason, internationallawyers.org remain committed to supporting the work of the Commission in every way that's possible. Thank you very much.
Thank you for that statement of internationallawyers.org. Drawing the attention of the Commission to issues relating to COVID-19, particularly as it relates to deportation of migrants and the impact that this would have on the spread of the pandemic, and calling for a moratorium of deportation, or in the case of deportation, vaccination before deportation. We also take note of issues relating to climate change and human rights, which the Commission is seized with, and the Commission has not been idle. It has been responding to issues arising in relation to climate change in its various mechanisms and processes. Also specifically highlighting human rights issues relating to Egypt, particularly as it relates to human rights defenders, and also the situation in northern Ethiopia, welcoming the statement of the National Human Rights Commission, but urging for investigation. Thank you for that once again. The next is RODDH. This is the NGO with observer status 398. Do we have? Okay, we have. While we are connecting with this one, I think, let me confirm if there are NHRIs or states parties that have been brought to the list, or if we have South Africa with us. Colleagues in the Secretariat, kindly confirm on these. So, Reginald, if you can confirm if we have a new list. While we are trying to connect with Okay, kindly confirm whether there are states parties that have registered to make their statements or other civil society organizations. Okay, colleagues, members of the Commission, staff of the Secretariat, our interpreters, as well as distinguished state delegates, NHRIs, and civil society organizations, we thank you very much for your participation during this fourth day of the 68th ordinary session. From what I can gather, the information in my hands, those were the only lists of statements ready for today, which means that today's session comes to an end. We will resume on Monday. I wish to thank all those NHRIs and civil society organizations who delivered their statements in the course of today. I also wish to thank all of you for your kind participation in this I'm just checking what is if there are. Okay, I am getting information that there are. Actually, I was going to close our session for today, but I'm getting information that there are a few additional organizations that could deliver their statements. So with your kind permission, colleagues, I'm going to proceed to give the floor to those institutions. East and Horn of Africa Human Rights Defenders Project. This is the NGO with observer status 359. If we have the representative of East and Horn of Africa Human Rights Defenders Project. Can we check if we have Zimbabwe Lawyers for Human Rights? Okay, while trying to reconnect with the representative of Zimbabwe Lawyers for Human Rights, can we also ask AIDS and Rights Alliance for Southern Africa to be on standby, please?
Hello.
Okay, very warm welcome to you, and you have 5 minutes, please. You have the floor. Thank you.
Honorable Chairperson, Honorable Commissioners, State Delegates, ladies and gentlemen, Zimbabwe Lawyers for Human Rights presents this statement on the human rights situation in Zimbabwe. Since our last statement during the 67th session, there's been continued regression and deterioration of the socio-economic and civil political crisis. With regards to the socio-economic rights, the COVID-19 pandemic has exacerbated the poor socio-economic conditions that were already existing in the country. Frontline health workers' needs and working conditions, including the lack of personal protective equipment, have not been fully addressed. Doctors and nurses are protesting these poor working conditions, have faced disciplinary or criminal proceedings, leaving the public health sector incapacitated. On the 22nd of February 2021, the government launched the National COVID-19 Vaccination Program, providing some relief to the sector. As of the 1st of April, A total of 125,000 vaccine doses had been administered. The pandemic has disrupted access to learning for at least 4.6 million children in Zimbabwe. It has deepened existing vulnerabilities and inequalities, especially for girls, children with disabilities, those in rural areas, orphans, as well as those from low-income households. The lack of school activity has also resulted in an increase of reported cases of child marriages, depriving affected children of the opportunity to complete their education. Although schools have recently reopened for face-to-face learning, teacher strikes against low salaries and the rapidly depreciating local currency has forced educational institutions to increase fees beyond the reach of many families. There have been widespread evictions and demolitions of irregular settlements, markets, tuck shops in urban areas, and threats to evict villagers from their homesteads in communal lands such as Chilonga to make way for agriculture and mining projects in the middle of the pandemic. During the rainy season, more than 10,000 homes were destroyed by floods, leading to a humanitarian and housing crisis. Some of these homes had been constructed on wetlands due to corrupt land allocations and weak implementation of environmental laws. Poor service delivery in urban areas continues to expose residents to diseases and an unclean environment. Of particular concern is the failure of local and central government to address water shortages and sewerage reticulation in high-density suburbs. Honorable Chair, the governance deficit has resulted in huge disparities of wealth. Political elites continue to benefit. Corruption, tax evasion, tax avoidance, illicit flows, and financial and smuggling in the mining sector is still rampant. The Minister of Home Affairs indicated that the country is losing an estimated of $100 million worth of revenue every month due to illicit gold trade. The growth of the informal artisanal mining sector without regulation or enforcement of health and safety measures is also exposing artisanal miners, including children, to dangerous chemicals, injuries, and deaths. With regards to civil political rights, since December 2020, the state has intensified the crackdown on freedom of expression, assembly, and association. State security agents have continued to use excessive force against unarmed civilians. Human rights defenders, including student union leaders, journalists, teachers, political activists, have been subjected to systematic abuse of the criminal justice system through arbitrary arrests, excessive pretrial detention, and malicious prosecution. Activists and protesters have been arrested through selective application of the COVID-19 lockdown regulations and abuse of criminal laws such as the recently passed Maintenance of Public Order Act and the Criminal Law Act. Freedom of expression continues to be under siege. In January 2021, internationally acclaimed journalist Hopo Chingono, MDC Alliance opposition MP Job Sikala, and spokesperson Fadzai Mahere were arrested for publishing false statements prejudicial to the states due to their alleged social media posts criticizing police brutality in response to claims of a death of a child. They were subjected to lengthy pretrial detention periods in maximum security prison in overcrowded, unhygienic conditions, resulting in Mahere contracting COVID-19. Political rights are still under lockdown. By-elections remain suspended, and the electorate remains unrepresented following the recalling of over 35 opposition parliamentarians and over 80 councillors. The government has continued with its efforts to amend the constitution in amendment number 2. The proposed amendments to 27 provisions are being introduced at a time when the 7-year-old constitution has not been fully implemented. In conclusion, the Zimbabwe Lawyers for Human Rights urges the African Commission to encourage the government of Zimbabwe to fully implement the recommendation of Resolution 443 on human rights situation in Zimbabwe, to provide adequate funding and resources for public service, particularly the education and the health sector, to cease unlawful evictions and any demolitions without court orders of vulnerable persons during the lockdown, to respect, protect, promote, and fulfill citizens' rights to assembly, association, expression, free speech, and peaceful protest. And lastly, to amend repressive laws and desist from introducing new laws restricting rights to assembly, and also to cease the process of amending the constitution and fully align all the laws with the constitution.
Thank you very much.
I thank you.
Thank you very much for that statement from Zimbabwe Lawyers for Human Rights, highlighting various human rights issues specific to the situation of Zimbabwe, including issues relating to socioeconomic rights, which challenge in relation to these having been exacerbated by the COVID-19 pandemic. Specific sector, particularly the health sector, being singled out in this statement as far as the poor working conditions of medical professionals is concerned, and the concern raised in that respect, issues of growing poverty and inequality, the fact that the closure of schools leading to child marriages, and thereby depriving the girl child of important opportunities in life. Issues relating to flooding, as well as poor self-service delivery that have been highlighted. I take particular interest, of course, on issues relating to the extractive industry sector. Quite a large sum of money being lost to illicit financial flows relating to smuggling of gold. Also questions relating to civil and political rights, including those affecting civil society organizations, opposition parties, and the suspension of by-election. We take note of that. I'm sure the country rapporteur is also following closely. I wonder if we have any of the other institutions with us. Do we have AIDS and Rights Alliance for Southern Africa? I'm not sure if we have that. Okay, do we have Human Rights Institute of South Africa? Okay, if we have Human Rights Institute of South Africa, and if they are ready, we'll give the floor for their statement. Okay, you are most welcome. You have 5 minutes, please.
Okay, sorry for that. Honorable Chairperson of the African Commission, honorable members of the African Commission, distinguished state delegates, ladies and gentlemen, Human Rights Institute of South Africa is privileged to present a statement on the situation of human rights in Africa. First and foremost, we commend the African Commission on Human and People's Rights for passing profound resolutions such as Resolution 449 for state parties to cultivate human rights standards safeguarded in the African Charter as core pillars in adopting measures to curb COVID-19. We have identified significant progress made in the realization of the African Charter in the SADC region. Just to name a few, 3 state parties have submitted their state reports on the African Charter and Protocol of the Rights of Women in Africa. And while the Kingdom of Lesotho was selected by the African Union to host the Secretariat of the African Committee of Experts in the Rights and Welfare of the Child. In addition, the South African government has become the world champion in the call for equitable access to COVID-19. This augurs well with the AU theme in arts, culture, and heritage to assert Africa's traditional healing methods developed for combating COVID-19. However, despite all these positive advancements, the democratic spaces promoting human rights guaranteed in the African Charter remains a difficulty for citizens to enjoy. COVID-19 pandemic protocol continue to be a tool used by state security agents to impede fundamental rights to assembly, association, and expression. Civil society organizations, human rights defenders continue to be meted with brutal killings, arbitrary arrests, malicious prosecutions, and reprisals. For example, in Angola, police used lethal weapons to disperse a peaceful protest held in January 2021 due to the lack of basic service delivery, resulting in 15 people being murdered, 22 arbitrarily detained, and 20 left injured. In Zimbabwe, Makomborero Haruzivish, a young leader, has been sentenced to 14 years imprisonment for malicious charge of public violence, incitement, and mobilization of citizens to revolt against police officers arresting vendors in Harare CBD. This is in spite of the African Commission passing Resolution 443 condemning human rights violations in Zimbabwe, including encouraging right to fair trial, partial investigation, prosecutions, and legal assistance. In South Africa, a bystander, Mthokozisi Mtumba, was murdered by law enforcement in indiscriminate shooting of a peaceful student protest. Disproportionate gender-based violence and femicide, hate crimes such as xenophobic attacks to migrants, and murder of persons LGBTIQ remain horrific, despite a progressive legal framework promoting the society based on equality and non-discrimination. The region was traumatized 3 weeks ago by insurgent extremist attacks of citizens in Palma, Cabo Delgado, a province in Mozambique. Terrorists have seized this province since 2017 without support from the SADC. The terror attack has left many citizens and expatriates murdered. It has caused severe humanitarian crisis that left over 700,000 citizens displaced and women subjected to multiple sexual violence. We call upon the African Commission on Human and People's Rights through its special mandate holder to urge the AU states to do the following. State parties to adopt laws aligned to Resolution 449, even during this pandemic era, to realize enjoyment of guaranteed rights in the African Charter. Promote AU theme on art, culture, and heritage to open public and transparent dialogue for participation of stakeholders, including traditional practitioners, in effort combating, curing, and humanizing COVID-19 pandemic. And arbitrary killings of citizens in assembly by transformation in using lethal weapons like rubber bullets, stun grenades, among others, and enact human rights principle to facilitate peaceful assemblies and create enabling environments for civil society organizations, human rights defenders, dissent, and opposition expressing their views in public affairs. Encourage the AU Peace and Security Council to coordinate peace and security efforts with SADC heads of state and governments, including the SADC organ on politics, defense, and security to accelerate humanitarian aid, protection of women, and dismantle terrorist attacks affecting Cabo Delgado province of Mozambique. Urge Zimbabwe government to release Makomborero Haruzivish immediately and unconditionally, as well as implement Resolution 443 to conduct fair Resolution 443 of the African Commission to conduct fair trial, impartial prosecution, investigation, and implement Resolution 275 to end arbitrary arrest, brutal beatings, torture, extrajudicial killings of human rights defenders, civil society organizations.
Your time is up.
Okay, I'm done already. Thank you.
Okay, excellent. Thank you for that statement of the Human Rights Institute of South Africa, highlighting issues relating to the enforcement of COVID-19 prevention or control protocol and the grave consequences that these are having in terms of particularly the various human rights. Specific reference have been made to specific country situations such as Angola, where protest events in January 2021 and the attempt at responding to those protest events leading to excessive use of force that resulted in death and injuries. Issues relating to Zimbabwe, including the arrest of vendors who try to meet their ends meet on a daily basis in this difficult environment of the COVID-19 pandemic. Hate crimes have been highlighted in relation to South Africa, affecting women, migrants, and LGBTI communities. And our attention is also drawn to the heinous terrorist attack that recently affected the town of Palma in Cabo Delgado province of Mozambique. And in this respect, a call has been made for the Peace and Security Council to coordinate with SADC in order to facilitate humanitarian access and protect the displaced, including in particular most vulnerable, including women and children. Thank you for that statement. Next is if we have, do we have the Center for Human Rights? Okay, do we have Organisation Mondiale contre la Torture?
The Center for Human Rights is available.
Okay, yes. I'm also calling on the organization, the NGO with observer status 5-2 to be on standby. Center for Human Rights, you have the floor for 5 minutes. You are welcome.
Thank you very much, Chairperson. Chairperson of the African Commission and members of the African Commission, the Center for Human Rights, Faculty of Law, University of Pretoria, would like to draw the attention of the Commission to the following issues. The first issue is the need to build African pharmaceutical manufacturing capacity. The Center for Human Rights shares the sentiment of previous NGOs that have spoken during this session on the need for waiver of COVID-19 vaccines patent in order to ensure widespread availability and accessibility of COVID-19 vaccines on the African continent. However, in addition to the above, the Center for Human Rights would like to reiterate that there is the need to acknowledge that the barriers to widespread availability of COVID-19 vaccines in Africa go beyond issues of intellectual property. Limited pharmaceutical manufacturing capacity in African states is an important limiting factor. We therefore urge African government to investigate the barriers to manufacturing of vaccines and other pharmaceuticals, such as inadequate incentives for investment, skill gaps, and weak regulatory environment, and address these issues with a view to strengthening their manufacturing capacity, if not for the current pandemic, at least for those of the future. The Center for Human Rights also urged the Commission to provide further guidance to states on this issue, building on its recent Resolution 449, particularly paragraph 16C and D, and also the Commission should expand on its 2008 Resolution 141 on access to health and needed medicines in Africa. The second issue for the attention of the Commission is the ratification of the protocol to the African Charter on the Rights of Older Persons in Africa. The COVID-19 pandemic has disproportionately affected older persons. The risk of hospitalization and death is significantly higher in persons over 60 years old and further increases with age. The COVID-19 pandemic has thus put a spotlight on the right and health of older persons and their underlying vulnerabilities, such as a lack of access to healthcare, neglect and abuse in institutions and care facilities. The protocol to the African Charter on the Rights of Older Persons in Africa provides guidance to states to more effectively address these underlying vulnerabilities. Sadly, to date, only 3 states, Benin, Ethiopia, and Lesotho, have ratified the Older Persons Protocol, and the protocol is still 4.5 years later, not in force. We note that 15 states have signed the protocol, and we also know that earlier in this session, Malawi pledged to become a party to the protocol. The Center urges these 15 states and Malawi, as well as other African states, to ratify the protocol on the rights of older persons to ensure a better protection of its older population. And we recommend that the Commission intensifies its campaign for the ratification of the Older Persons Protocol and closely locates this campaign within the context of the current COVID-19 pandemic. The third issue for the attention of the Commission is state reporting under the protocol to the African Charter on the Rights of Women in Africa, the Maputo Protocol. As of April 2021, the Maputo Protocol has been ratified by 42 African states. Article 26.1 of the protocol requires state parties to submit a report every 2 years to the African Commission, stating measures that have been taken to comply with the provisions of the protocol. However, despite this obligation, states often do not report or report very infrequently. Reporting states also do not follow the guidelines for reporting. The Center encourages states to report and urges reporting states to follow the guidelines. The Center also makes itself available to provide technical support to strengthen the reporting capacity of state parties to the Maputo Protocol. The fourth issue for the attention of the Commission is the need to popularize General Comment 6 of the African Commission. In November 2020, the African Commission launched its General Comment 6, which focuses on women's right to property during separation, divorce, or annulment. The objective of General Comment 6 is to limit the vulnerabilities that women face when marriages break by providing guidance on how marital property should be shared fairly and in a manner consistent with the notion of substantive equality between women and men. The Center appeals to the African Commission to popularize General Comment 6 and to encourage states to apply its content and to report on its implementation in their periodic report to the African Commission. The final issue for the attention of the Commission is the insurgency in Cabo Gado province of Mozambique. The Center notes with concern the escalating state of insurgency and hostility in the Cabo Gado province of Mozambique. Reliable reports indicate that violent attacks in the region from insurgents have since 2017 escalated and led to loss of life, internal displacement, and gross violations of human rights in the region. The situation in Cabo Honorable Commissioner, I'm rounding up now. The situation in Cabo Delgado threatens the peace, security, and democracy, as well as the rights provided by the Charter. We recommend that the Commission launches an investigation into the human rights abuses in the region and collaborate with organs of the African Union, particularly the Peace and Security Council, to offer assistance in the areas of concern. We also urge the Commission to liaise with the government of Mozambique in order to facilitate a meaningful intervention in the region. Thank you for your attention, Honorable Chairperson and members of the African Commission.
Thank you for that statement of the Center for Human Rights. First, speaking to the issue of access to vaccine, and in that respect, supporting the call for the waiving of patent, the application of patent requirements relating to the COVID-19 vaccine, but also highlighting the need for expanding manufacturing capacity on the continent. This is also an issue highlighted in the two-day high-level meeting that the African Union convened just a day before, 2 days before this session. And indeed, this is of strategic importance for the continent and indeed for the health and life of the people of the continent. We take note of the point relating to expanding the guideline of the Commission based on our paragraphs 16C and D of Resolution 449. We also appreciate the attention drawn to the need for expanding the ratification of the protocol on the rights of older persons, considering the disproportionate impact of COVID-19 on older persons. And indeed, this is an area that we join you in calling on states parties to ratify and follow the 3 states that have ratified the protocol on older persons. The state reporting of the Maputo Protocol is again being repeated, as well as issues relating to Cabo Delgado. We take note of the specific point about the need for undertaking investigation in relation to that situation, and the general comment number 3. Thank you for that statement once again. Next, if we have Africa Freedom of Information Center. Africa Freedom of Information Center. This is the NGO with observer status 434. No, we don't? Okay. Now, it's almost, I think, is it 2 or 3? I think it must be 2. I wish to thank dear colleagues, members of the Commission, staff of the Secretariat, our interpreters, for the work that has been done in the course of today, and wish to thank all those NHRIs and civil society organizations who delivered their statements during the course of this 4th day of the 68th Ordinary Session, and wish to thank once again all state delegates, NHRIs and civil society organizations for being with us on this Saturday of the 17th of April. I do hope that all of you have a very nice rest of the day on this Saturday and a nice Sunday tomorrow. We will resume back again on the 19th of April, Monday at 9 GMT. I wish you all very well, and I hope you keep safe. Thank you very much again.